Hello everyone. For those who are attending my session for the first time, I am Dr. Priyanka here and I welcome you all for today's session. A very, very good evening to all of you. I guess I'm clearly visible, audible, right? Okay. I guess I'm clearly visible, audible. Okay. So I welcome you all for today's session, and today in this session, we are going to start systemic microbiology. Okay, I will be teaching you one of the most important system in systemic microbiology, that is bloodstream and CVS infection. Today, we are going to cover 21 organisms. I will teach you all bacteria, viruses, parasites and fungus which are there in CVS, bloodstream and CVS. All the organisms which we are going to cover today. Before I start, I want to ask you something. How many of you feel that systemic microbiology is so confusing? You start reading microbiology, you read the general microbiology, you are happy. But once you start the systemic microbiology, you get confused. You find it very difficult. You read the one organism, you forget the previous one. And you feel there are so many headings, there are so many subheadings. How many of you have this feeling? You can write this in the chat box. How many of you have this feeling? Just a second. Yes? You feel so? Yes. Yes or no? You tell me. So what is the problem? Why you feel like this? The problem is, according to me, the problem is NMC CBME new curriculum, the shift. I guess all the students, all the MBBS students who got admission in MBBS after 2019, they are aware about this shift, right? Before 2019, in microbiology syllabus, in microbiology curriculum, the syllabus was organism-wise. I mean, in the syllabus, there is bacteriology, virology, mycology and parasitology. But after 2019, the NMC's new curriculum, CBME new curriculum, it is system-wise now. It is not organism-wise. It is system-wise. So there are 8 systems of human body. So the bacteria, virus, parasite and fungus are divided in the 8 systems, and there is lack of resources. There is lack of resources according to the new curriculum. That is the biggest problem, I think, in microbiology. And that's why most of the students find systemic microbiology difficult because of this. Yes or no? Is it the problem? But according to me, I don't think the shift is from only organism-wise to system-wise. Actually, the shift is from memorizing organisms to understanding how they actually affect in the body, how they actually affect each system in the body, and this shift is necessary. Do you think this shift is necessary? Why NMC have changed the curriculum? Why there is new CBME curriculum? Why can't we read the microbiology still like bacteriology, virology, parasitology, mycology, like the old syllabus? Why can't? Because the new syllabus, the new curriculum, it provides you a new approach that mirrors how a doctor actually think in real life clinical scenario. Let me give you an example. Just 1 minute. Suppose a patient comes to you. You are a doctor, na? Of course, you are a doctor. A patient is coming to you with certain symptoms. Say some blah, blah, blah symptoms. The symptoms can be anything. Patient will come to you and tell the symptom. Patient will not say that, doctor, I am having a bacterial infection. Kindly treat me. Doctor, I am having a Just a second. Doctor, I am having a bacterial, viral, parasitic or fungal infection. Kindly treat me. Patient will not tell you this. Patient will tell you the symptoms. Based on the symptoms, you will identify the system which is involved. Respiratory system, cardiovascular system, skin system, and based on that, you should have your differential diagnosis of bacteria, virus, parasite, fungus. That is the approach that you have to understand. So this shift is really very, very necessary. But the problem is it's difficult to adopt. Even for me, when the syllabus is changed, I struggle to make the content according to the new curriculum. And that's why, most of the students ask me, ma'am, which approach is good? Is it organism-wise, which was the old syllabus? Or is it system wise according to the new syllabus? Which one is better? Which one is good? So answer is none of them. You have to integrate both of them. And here I am presenting my course, FinalGear Microbiology, in which I have integrated the old as well as new approach in a color-coded system. And I named it as FinalGear Microbiology. It's a 25-hour rapid revision, as you know, in which I will cover the entire microbiology in just 7 sessions. One is already done yesterday. Today is session number 2, right? And after this, we are having 5 more sessions in which we will pack the complete microbiology, right? There will be 4-hour session each day. All the sessions will be in the evening. You can see the detailed schedule. This session is already done. This one is going on. The remaining 5 sessions will be on the app. Will be on the app, MedLife by Dr. Priyanka app. Okay, the remaining systems we will cover. And we will integrate the old and the new syllabus and we will study in a color-coded unique way. I will tell you my way. So here, I will cover the entire microbiology in just 25 hours. It will be super rapid. It is high yield. It is compact yet complete. I commit you, mind my words. I will teach you all 158 organisms, including all bacteria, all virus, all parasite, or all fungus. Out of it, 21 we are going to cover today. Because out of this 158, 21 are coming in CVS, Bloodstream and CVS. I will tell you, I will teach you 5 bacteria, 5 virus, 6 parasite and 5 fungus today. I will teach you 21 organisms out of 158 today, right? So make a count. I will not skip even the minor organism. In this rapid revision, I will teach you according to the new CBME curriculum, and you can take my words, it is 100% strike rate. Whether you are targeting for your university exam, you know the headings under which you have to write your long answer, short answer. Okay, very short answer. If you are targeting for your NEET PG, FMGE, INI-CET, you check any of your PYQ or any of your question from any platform and you search in this course in my master chart. You will find the answer in that. That's my challenge. Okay, kindly dare to accept it. Okay, chalo. So how I'm going to do that? You may be thinking it's a big deal, ma'am, to cover all these in just 6 sessions. One is already done. That is general microbiology. How I'm going to cover that? So the answer is I'm going to cover with the help of color-coded master charts, microbiology master charts. Today I will introduce my color-coded microbiology master charts. Actually, it's a calendar. You can see it's a calendar. I have given 8 colors to 8 systems. You can see. I will tell you my color coding. You can make your own. Okay. And we will cover all 158 organisms in a color-coded system. I will tell you how. Okay. So let's start it. So this is my break. You can see the bacteria, virus, fungus, parasite, total 158 organisms we will cover in just 6 sessions, in just 60 pages. 6 sessions, 60 pages, complete microbiology, complete systemic microbiology. Now, I'm starting the session now. Okay, before that, there is a very important announcement for you. Okay, after the session, we will conduct a quiz that will have only 10 questions. The 10 questions will be from this session only. So be with me for the next 4 hours. If you be with me for the next 4 hours and you are attentive during the session, you will be able to crack these 10 questions. And if you are lucky and you are among the top 20, you will get free subscription of FinalGear Microbiology. Up to 100% scholarships is there. So kindly do attend. The test will be live after the session end and it will be there only for 20 minutes. For each question, you will get 30 seconds. Okay, so be with me and be attentive for the next 4 hours and you will have a chance to win it for free. Now, if you ask the queries during the session, maybe the checkbox is running so fast and I'm also running so fast. Okay, so maybe I will not be able to attend your queries, but I actually want to do so. Okay, but due to constraint of the time, I have to cover 21 organisms today. So I request you, if you have any query and I'm unable to answer it here, so kindly don't think that I'm not answering your queries. Kindly text your queries. WhatsApp your queries on this number. Note down this number. Okay. Whenever I will be free, I will leave a voice message on that. Okay. So during the session, I'm having an eye on the chat box. I will try to attend your queries. But sometimes, in the flow, I'm not able to attend it. So I'm really sorry and pardon me for that. Okay. So let's start it. Now, one more thing. Have you downloaded the workbook? It's already there in the comment section. It's already pinned. So you have to download the workbook. Otherwise, you will not be able to pace up with my speed. And you say that ma'am is teaching so fast. What is workbook, by the way? In workbook, 60% of the content is already printed for you. 40% is blank. You have to take the printout of the workbook and you have to fill the blank spaces with me. The blank spaces are intentionally blank there. I have made this workbook very judiciously for you. Okay, each and every space is planned. You have to fill it so that that word fits in your mind. And you will save your time because 60% is already printed. Okay, and you will be able to cope up with my speed. Notes will be uploaded after the session. In this comment box only, it will be pinned. Okay, the complete notes. Can I start the session? How many of you are ready? Give me a thumbs up. Everyone. Each and every one of you. Yes, it is more than sufficient for university exam. It is not sufficient. I will say it is more than sufficient. Rather than I answer, be with me for the next 4 hours and you yourself decide whether you are able to crack each and every question of this unit after the session, yes or no. If the answer is yes, of course it's sufficient. Yes or no. So can we start? Everyone give me a thumbs up. Show me some energy. Chalo. So let's start it. Let's inaugurate systemic microbiology. Yesterday we have covered general microbiology and today we are covering systemic microbiology, right? Now in our syllabus we are having 8 systems. You can appreciate the 8 systems. To these 8 systems I have given 8 colors. Okay, my color coded microbiology, my color coded systemic microbiology, a new way to see microbiology, to approach microbiology. Okay, see the color coding. You can follow any color coding. This is not universal color coding. This is the color coding given for my course. Okay, today I am taking the first system. I am taking Bloodstream and CVS. The color for the system is red. So today is red day. Okay, so every day I will take one system or two system and we will finish all the organisms belonging to that system. Now in each system, there are bacteria, virus, parasite and fungus. In each of them, we have four sections. Some bacteria, some virus, some parasite, some fungus. So in CVS also, we are having some bacteria, some virus, some parasite, some fungus. Yes. So let's start. Let's start bloodstream and CVS infection. See the classification. First of all, you have to learn this classification. How many bacteria are there in CVS? How many bacteria? How many viruses are there? How many parasites and how many fungus? So total, how many organisms are there in CVS and bloodstream infection? So you can see there are 5 bacteria, 5 viruses, 6 parasites and 5 fungus. So I would say total 21 organisms that we are going to deal today. We are going to cover today. Yes or no? So first you have to learn their names. You have to see how many bacteria, virus, parasite, fungus. Now you all are doctors? Of course. Suppose a patient is coming to you, okay, and patient is having the symptoms. The symptoms is indicating that patient is having serious involvement. Okay, suppose the patient is having chest pain. Suppose the patient is having dyspnea. Suppose the patient is having change in blood pressure, change in heart rate. And if you are examining the patient, if you are auscultating the patient and you got some abnormal heart sounds or murmurs, it indicates that CVS is involved. And being a doctor, CVS is involved, you can judge from the symptoms and signs. And you are suspecting infectious etiology. If you are suspecting infectious etiology with these symptoms, you should think about the 21 differentials. The 21 differentials are in front of you. You should think about the 5 bacteria, 5 viruses, 6 parasites and 5 fungus. Total 21 differentials should come immediately in your mind with these symptoms. Because patient is presenting with the serious infection. If you are thinking of infective etiology, maybe these symptoms due to serious involvement but non-infective etiology. But if you are thinking infective etiology, you must think about these 21 organisms. Now we will take detailed symptoms, detailed signs. We will do some lab diagnosis and we will reach on one. out of 21, and we will give the specific drug to treat that. Okay, so that is the approach. How many of you got it? So total 21 organisms. I already given the split. So 5 bacteria, 5 virus, 6 parasite, and 5 fungus. I will tell you their names. I will tell you how uniquely I am going to teach it. Yes or no? You are getting it? I am going to teach all these 21 organisms in just 7 pages. Yes, you heard me right. You heard me right. 21 organisms, ma'am, in 7 pages? Are you kidding? No, I am not kidding. These are my 7 pages, the live proof in front of you. I dare you, I challenge you to find any missing thing out of these 21 organisms in the 7 pages there. The 7 serious pages. I will show you one by one. So, I will cover all these organisms in just 7 master charts. Okay. These are my comparative tabulated master charts. So, let's talk about them one by one. Let's talk about the bacteria. What are the 5 bacteria which cause serious infection? Out of these 7 master chart, I will teach you the 5 bacteria in 2, the 5 parasites in 2, okay, the 6 parasites in 2, and fungus in 1. You can see the 5 bacteria. The first bacteria is Typhoidal Salmonella. I will teach you. I will start my session from here. The second bacteria I will teach you is Rickettsia. Okay. The third bacteria I will teach you Brucella. Fourth is Leptospira, and fifth is Borrelia. So with this, I will cover my 5 bacteria under a fixed set of heading. You have to write this fixed set of heading. You can see the cluster of 10 headings. Okay. In the introduction, I always tell the name of the scientist. Morphology, culture, bio, you will understand the pattern. So under these fixed 10 headings, we will learn these 5 bacteria. You got my point? So what you are waiting for? Why don't you take out your notebook and pen and fill this with me? So your master chart will be ready. 7-page master chart will be ready by the end of the session. So I challenge you, just by the end of the session, you revise the 7-page master chart and go frankly to go give your exam. All the question will be from that 7 pages only. Whether it's a university exam or it's a competitive exam MCQ. Okay, chal. So that is the bacteria. Coming on viruses. The 5 viruses. Which 5 viruses? I will teach you 5 viruses. The first virus I will teach you is HIV. The second virus I will teach you is Dengue virus. The third virus I will teach you Chikungunya, then KFD, then Ebola. So these are the 5 viruses under a fixed set of heading. The headings of virus is different from bacteria. You have to learn the set of heading. Learn the set of heading for bacteria. Learn the set of headings for viruses. Okay. After that, I will come on parasites. Have a look. I will come on the parasites. I will teach you 6 parasites. How many? 6 parasites. You can see Plasmodium, Babesia, Leishmania donovani, then Trypanosoma cruzi, Trypanosoma cruzi, and Bucheria bancrofti. These are the 6 parasites under a fixed set of heading. Again, the set of heading is different. And finally, I will come on fungus. The 5 fungus. You can see the 5 fungus on one page. Histoplasmosis, Blastomycosis, Coccidioidomycosis, Paracoccidioidomycosis, and systemic candidiasis, again under a fixed set of heading. So that is the way you should read microbiology under comparative table. So you can understand the positive organism at one place, pathogenesis at one place, drug of choice at one place, and you can compare them very easily. You can retain them very easily. Otherwise, if you learn like this now, when you reach the next one, you forget the previous one. You reach the next one, you forget the previous one. That is very volatile. But if you read in comparative columns and you keep on looking at them frequently in comparative columns, it will be very easy to retain. I hope you got my way. Can I start now with this approach? Can I start? Yes or no? So let's start it. I know initial 10 minutes was just the orientation, but it was necessary. Otherwise, you don't understand my pattern. I think we should start now. So let's start the session. I will be teaching the session in 4 parts. First, I will teach you bacteria, then virus, then parasite, and finally fungus. In these 4 sections, okay, bacterial infection of CVS, viral infection of CVS, parasitic infection, and fungal infection of CVS. Total 21 organisms I will teach you in a comparative manner. Okay, so I request you to write with me, to take out your notebooks and make the comparative columns or master charts with me. It's best to make your own master charts. Okay, and if you don't want to write it, the master charts, the ready-made master charts are also available. They are already filled, but I don't recommend to take the pre-filled one. These are already filled. These are filled by me. These are printed version. You can see I have created it. Okay, but if you fill by your own, now it will retain in your mind. So I request you to make your own master charts. Chalo, come on. Let's start the first section. Let's start the bacterial infections of CVS. So there are 5 bacteria to be dealt with. I already told you the name. Step number 1. Learn the 5 bacteria. If I ask you, tell me the bacteria which cause infection in CVS, you should tell these names first. You should know the 5 names. What are the 5 names? Say with me. What are the 5 names? Typhoidal Salmonella. Okay, there is non-typhoidal Salmonella also. I will teach you that one in GIT. So Typhoidal Salmonella cause CVS infection and non-Typhoidal Salmonella cause GIT infection. That's why I have written Typhoidal. Okay, so Typhoidal Salmonella is there. Second, Rickettsia, then Brucella, and then the 2 spirochetes, Leptospira and Borrelia. I guess you know these are spirochetes. Learn the 5 bacteria. Let's start the first one. You can see the 5 bacteria. You can appreciate the 5 bacteria over here. Okay, let's start it. Okay, before I start, let me help you in revision of yesterday's session. You tell me how many of you were present yesterday? Were you present yesterday? Yes or no in my yesterday's session? In my yesterday's session, I taught you the classification of bacteria. Yes or no? This is the same classification. We divide the bacteria in 4 categories. What are those 4 categories? Gram-positive cocci, gram-negative cocci, gram-positive bacilli, gram-negative bacilli. You can count total 60 bacteria in front of you. I will teach you all 60. But today I will not teach you all 60. Today I will teach you only 5 of them. Which 5? The one which are in red color. The one, okay, the one which cause serious infection. So where are my 5 bacteria of today? Today's 5 bacteria. Where are these 5 bacteria? These 5. I'm interested in these 5. I'm not interested in all 60. No, I'm interested in these 5. So let's highlight these 5. So you can see. I will teach you Salmonella. I will teach you Rickettsia. I will teach you Borrelia. Just a second. What happened? Rickettsia, Borrelia, Leptospira and Brucella. You can see which of them is gram-positive, gram-negative, cocci, bacilli, which of them is coming in miscellaneous. So before I start, you should have an overlook. Okay, now see this. So this is the same classification. See this one, see this one. Again see what I am telling you. See this one. See the name of the 60 bacteria. Okay, they are not color-coded. See the name of the again 60 bacteria. They are given 8 color depending on the system. You can see. The same classification is given over here. You can appreciate the same classification. Now pick out the red ones. See this, pick out the red. Today I am interested only in red. Where is red? My red. The 5 red bacteria. You can appreciate. Here we have, here we have, here we have, here we have, and here we have. So today I am going to teach you these ones. So with this introduction, I guess you got my approach. So before I start, you must understand the approach. Otherwise, how you will understand? So let's start it now. So let's start with the first bacteria, Typhoidal Salmonella. Under these headings, let's start this one. So first of all, I'm teaching you Salmonella, Typhoidal Salmonella. Introduction mein I used to teach you the scientist, the historical part and something important. So who discovered Salmonella? Salmonella is discovered by Salmon and Smith. And that's why to honor the salmon, we have named it Salmonella. That is the historical aspect. Okay, who discovered Salmonella typhi? This is overall Salmonella. Who discovered Salmonella typhi? Who named it? So there is another scientist. It is known as Ebert and Grappe. Ebert and Grappe observed this, discovered it, this first time observed it. Salmonella typhi. Okay, what is Typhoidal Salmonella? I am teaching you Typhoidal Salmonella. Na? You may be thinking, ma'am, name the Salmonella. How many Salmonella are Typhoidal Salmonella? There are 4 Salmonella which come under Typhoidal Salmonella. Which 4 Salmonella? So Salmonella typhi, paratyphi A, paratyphi B, paratyphi C. These 4 Salmonella together known as Typhoidal Salmonella. Why? Because they cause typhoid in human. They all cause typhoid in human. We are having non-typhoidal Salmonella also. They cause gastroenteritis. I will teach you them in GIT. Okay. But these 4 cause typhoid fever, which is the infection of CVS. That's why I am teaching you these 4 here. So if I have written Typhoidal Salmonella, I mean 4 organisms. I mean Salmonella typhi, Salmonella paratyphi A, Salmonella paratyphi B, Salmonella paratyphi C. So all 4 I am teaching you together. By the way, you should understand this. So in the introduction only you should write all these things. In short, very short, in your own language, you just write all these things. Coming on the next heading, morphology. Now please understand, since this is the first bacteria, na, I will be slow, little bit slow. But from second bacteria onwards, I will fly. Okay, and you have to pace, coop up with me. Listen. By morphology, what I mean? Let me explain. By morphology, I mean 4 things. First of all, in the morphology, you have to tell me gram status. Gram status of that bacteria. Whether that bacteria is gram-positive, gram-negative, cocci or bacilli. Is it GPC, GNC, GPB, GNB? First, you have to tell me regarding this bacteria. Number 1. Number two, you have to tell me whether it is capsulated or non-capsulated, whether it is spore forming or non-spore forming, whether it is motile or non-motile. Okay, now I have seen the students who used to learn. This is plus, this is minus, this is minus, this is minus, this is plus, this is minus, this is all minus, this is plus, plus. You will become mad when you learn this for 60 bacteria and you will forget everything. Okay, you can't learn this. This thing you will tell me from the classification. I told you the classification, GPC, GNC, GPB, GNB. You know where does Salmonella come? Salmonella come in GNB, gram-negative bacilli, Enterobacteriaceae. You know that. So ye to pata hai. This you can tell me. But what about capsule, spore and motility? Who attended my yesterday's session? Who of you? Have you attended? I told you the mnemonic of all three. That's why I took the general microbiology first. Yes or no? So you have to just apply the mnemonic. Have a look on the mnemonic. Yesterday I taught you this mnemonic. Na? There are only 9 bacteria which are capsulated. There are only 4 bacteria which form the spore. And there are only lucky 12 bacteria which are motile. 6 by polar, 6 by peritrichous. I taught you this yesterday. I'm not reading this mnemonic. You read by yourself. Okay, so what is my bacteria right now? Which bacteria I'm teaching you? Please understand my way. In the first bacteria, you may find it difficult. But from second bacteria onwards, it will be so easy. It will be like a cakewalk. Believe my words. Give me some time to explain you. So what is my bacteria right now? I'm teaching you Salmonella. Okay, non-typhoidal Salmonella. So does Salmonella come in this mnemonic? Does Salmonella come in this mnemonic? Or does Salmonella come in this mnemonic? Say yes or say no. So Salmonella is not coming in this mnemonic. It is no capsule, non-capsulated, non-sporing and non-motile. I don't have to learn. Okay, what is mathematics? Mathematics. It's a subject we don't learn. We solve it on the spot. On the spot, we solve and we come on a conclusion. Yes or no? Similar way, morphology is something you don't have to learn. Morphology is something you don't have to learn. You just learn 3 mnemonic. Okay, the mnemonic of capsulated bacteria, the mnemonic of spore forming bacteria, and the mnemonic of motile bacteria. You just learn 3 mnemonic. You apply that particular bacteria on the spot in the 3 mnemonic. Whether the bacteria coming in this mnemonic, yes or no. And you come on your conclusion. So morphology, you don't have to mug up. First thing, you understand this. Learn 3 mnemonic forever. Okay. Now, we have seen, I'm sorry. It is non-capsulated, non-sporing. You can see it is not coming in this mnemonic, not in this mnemonic, but here I have done a mistake. It's coming here. You can see Salmonella. Let me search. Salmonella. All Salmonella are motile. Yesterday I taught you, except Gallorium and Pullorum. Yaad aaya? Yesterday I taught you. So all Salmonella are motile, except Gallorium and Pullorum. So I'm not teaching you Gallorium and Pullorum. I'm teaching you Typhoidal Salmonella. So it's motile. So this one is motile. So non-capsulated, non-spore forming, but motile. Okay, got it. So that is the morphology. Non-capsulated, non-spore forming, but motile. Whenever you say motile, you are not allowed to say only motile. You are not allowed because now you are an MBBS student. You are not kids now. Okay. So first you have to tell me, is it polar or peritrichous? Saying only motile is not sufficient at your level. Okay. You have to tell me whether it is peritrichous motile or polar motile. So in which mnemonic it is coming? You can see Salmonella is coming in peritrichous flagella. Okay. So learn the mnemonic. People, these are your weapon. Without weapon, you cannot win a war. Yes or no? So you can see no capsule, no spore, but motility present and with the help of peritrichous flagella. All Salmonella are motile except Gallorium pullorum. So this page I will not, and it is gram-negative bacilli. You can see this one is gram-negative bacilli. Here is the Salmonella. Okay, it's a gram-negative bacilli. So I don't think here's something I have to learn. I will cancel this page. I will not learn anything on this page. Not anything. Morphology never learned. Okay, apply it on the spot. I hope everyone got my approach. Coming on the next heading, culture. This was your homework yesterday. How many of you done the homework? Yesterday I told you to learn the selective media. I have given you a list in yesterday's notes. To learn the selective media of all 60 bacteria. I have given you that list. I taught you culture media yesterday. So you have to learn the selective media of all the bacteria. By the way, what is selective media? Yesterday I taught you what is selective media and what is enrichment media. Selective media and enrichment media. In both of them, we add either stimulatory substance for the bacteria of choice. Okay, for the bacteria we want to grow. And inhibitory substance for the bacteria we do not want to grow. Okay, so if it is a liquid, we are adding these in a liquid, it is enrichment growth. And if we are adding these in a solid media, it is known as selective media. Yesterday I taught you this, yes or no? So tell me the selective media for Salmonella and tell me the enrichment growth for Salmonella. You have to learn it, but in an easy way you have to learn it. So selective media are three. What are the three selective media? DCA, XLD, BBSA. Learn their full forms also if you wish. What is DCA? Deoxycholate citrate agar. DCA. What is XLD? Xyloslicin deoxycholate. XLD. And what is BBSA? Wilson and Blair is the name of the scientist. It's brilliant bismuth sulfite agar. Brilliant bismuth sulfite agar. BBSA. Wilson and Blair. And for image-based question in your competitive exam, learn the images also. This is DCA. On DCA, the color of the colony is yellow with black center. This is XLD. On XLD, the color of the colony is red. Red with black center. Here, yellow with black center. Yellow with black center. Red with black center. And on BBSA, this one is BBSA. On BBSA, it's black color. This portion. Only black. So see the color of the colony. Yellow with black center. Red with black center. Black. So if you wish, you can write down the color of colonies here only. This one is yellow with black center. This one is red with black center. And this one is only black. Only black colony. Sometimes you get image-based question. That's it. Okay. Coming on liquid media. Liquid media are broth. Learn three broth. Yesterday I taught you this. Selenite F broth, tetrathionate broth, and gram-negative broth. So they contain the stimulatory substance for Salmonella. So Salmonella will grow. And they contain the inhibitory substance for all other bacteria. So all other bacteria will die. Okay. Similarly, they contain the stimulatory substance for Salmonella and inhibitory for others. But this is solid. This is liquid. Everyone give me a thumbs up. Yes or no? Everyone got it till now? So culture is done. So till now we have seen intro, we have seen morpho, we have seen culture. In the end, I will fill my master chart with you. Yes. Coming on biochemical reaction. Now biochemical reaction is something more of factual. I agree. You have to learn it. You will say, ma'am, it's rectification, it's factual, non-conceptual. I agree. But if you learn in comparative manner, now you can easily compare all of them. Okay. So learn them in a sequence. If you make a sequence, it's very easy to compare them. Okay, so my sequence, let me tell you my sequence. I always write catalase, then oxidase, then indole citrate urease. So my mnemonic is C-O-I-C-U. C-O-I-C-U. First C is catalase, next C is citrate. Okay, and I learned the sequence. It's positive, negative, 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 negative. Positive, negative, 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 negative. What I told you? What I told you? Biochemical reaction always by default make one sequence. Not necessary you make this sequence only. This is my sequence if you want to follow it. Okay. So I always learn biochemical reaction in this sequence. C-O-I-C-U. C-U. So catalase, positive or negative. Oxidase, positive or negative. Indole, citrate, and urease. And I learned the sequence. This is the easiest way you can learn the biochemical reaction. So here only citrate is positive, rest all is negative. Salmonella is only citrate positive. This is what you have to learn. And you have to learn like plus minus. I guess you know the principle of all these tests. Yes or no? So biochemical reaction. Coming on my next heading. The next heading is the antigenic structure. What is antigenic structure? Or virulence factor, whatever you say. See the diagram of Salmonella. The Salmonella is like this. Let me draw the Salmonella for you. Okay. So suppose this is the bacteria. Cell membrane of the bacteria. This is the cell wall of the bacteria. On the cell wall, we have an antigen. The name of this antigen is O antigen. O antigen is present on cell wall. It is known as somatic antigen. Now see here I am drawing the flagella. These are the flagella. Okay, this is the flagella. So the antigen which is present on the flagella, flagellar antigen is H antigen. H is present on flagella. O is present on cell wall, H is present on flagella. Okay, and third antigen, we are having a mucus covering. We are having a covering, not exactly envelope. It is not exactly capsule. It is not capsule. It is sort of envelope, not well-formed capsule. On this, we are having the third antigen. The third antigen is known as VI. So there are three antigen people. What are the three antigen? Can you tell me? What are the three antigen? Can you tell me the three antigen? It's gone. So O antigen, you can see H antigen and VI antigen. O, H and VI, the three antigen. Now suppose this Salmonella enters in my blood vessel. This is my blood vessel. Appreciate the blood vessel. See, this is the blood vessel and Salmonella have entered the blood vessel. So O antigen, H antigen and VI antigen all entered in the blood vessel. So body will make antibodies against that. Yes or no? So body will make anti-O, anti-VI and anti-H. Okay. So what is the order of antigenicity? Maximum antibodies are formed against which? And minimum antibodies are formed against which? You know that? The order of antigenicity is HOVI. HOVI. Maximum antibodies are against H. Uske baad, the second number is O. And minimum antibodies are against VI. You get this question. This is order of antigenicity. The order of antigenicity is HOVI. HOVI. Okay, maximum antibodies against H, followed by O, and followed by VI. This is the order of antigenicity. So same thing is written. HOVI. The order of antigenicity is HOVI. Got the meaning of this? Now you know Vidal test. I will tell you in lab diagnosis. In lab diagnosis, I will tell you a test. The name of the test is Vidal test. In Vidal test, what we test? In Vidal test, we don't test bacteria. No. We don't test antigen. We test antibodies against the antigen. We test antibodies. Vidal test is testing antibody. First of all, we don't test antigen in Vidal. In Vidal, we test antibody. You are getting my point? We are testing antibody there. So we don't test VI because it is least antigenic. Okay, the antibody against VI is very less. Why we will test it? So we will test anti-H and anti-O. So Vidal is testing anti-H and anti-O. I hope you got it. That is the antigenic structure. Coming on pathogenesis. Rather than reading the flowchart, let me draw it for you. Let me draw it for you. So here is the bacteria entering. Okay, how does the salmonella enter the human body? Eating, ingestion of contaminated food and water. So this person is eating food and drinking water which is contaminated with salmonella, typhoidal salmonella. So route is feco-oral. Route is oral. It is not inhalation. It is not sexual. It is not skin penetration. Okay, it is oral, feco-oral, ingestion. What is the infective dose? The infective dose is 10 to the power 3 to 10 to the power 6 bacilli. So minimum it should be 10 to the power 3 to 10 to the power 6 bacteria present in the food. Then only it will cause salmonella. It will cause typhoid. Otherwise, it will not cause typhoid. So learn the minimum infective dose. You get MCQ on that. What is the minimum infective dose? 10 to the power 3 to 10 to the power 6 bacteria. They will go inside. They will go inside. They bypass acidity. They further go inside. They go inside. They reach in the intestine. In the intestine, they enter the intestinal epithelial cell. After entering the intestinal epithelial cell, they are engulfed by the phagocytes, by the macrophages, by phagocytes. But they resist intracellular killing. They are not killed by phagocytes. It's a unique property. They are not killed by phagocytes. After that, they enter the pair patches in the lamina propria. They go in the lamina propria. They enter in the pair patches. From the pair patches, they go in the blood. Okay, they reach the blood. From the blood, they enter RE system, reticuloendothelial system. Multiple organs. They enter the liver. They enter the bone marrow, they enter the spleen. After that, they enter other organs also. Like they enter the gallbladder, they enter the kidney, they enter the urinary bladder. Okay, so this is the complete pathogenesis. Don't learn it. Now read the flowchart, it will be fun for you. Read this flowchart. Whatever I have explained you here, now everything is written over here. Now read it. When it is an intestine, here, it causes longitudinal ulcers in the intestine. It is causing longitudinal ulcers in the intestine. Appreciate. Okay, got it? Now see, you can read it. So the minimum infective dose, it is entering via contaminated food and water. Minimum infective dose you have seen. It reaches the small intestine. It goes in the epithelial cell of the small intestine. It goes in the lamina propria. It is engulfed by the phagocytes. It resists intracellular killing. Okay, after that, it enters the mesenteric lymph nodes. It enters the pair patches. Then it enters the blood. Okay, causing bacteremia. After that, it enters many organs and do multiplication in the blood. Okay, and the symptoms will come. This is the pathogenesis. It's very easy to understand and write the flowchart. I hope you got it. Mode of transmission is fecal-oral. I already taught you. Clinical feature. Whenever I say clinical feature, people, whenever I say clinical feature, you have to tell me the name of the disease and symptoms under it. What's the name of this disease? What is the bacteria, by the way, I'm teaching you? वो तो नहीं भूल गए? I'm teaching you Typhoidal Salmonella, okay, which includes 4 bacteria. Salmonella typhi, Salmonella paratyphi A, paratyphi B, paratyphi B. तो ये करते क्या हैं? Which disease they cause in human? The name of the disease is typhoid fever or enteric fever. Meaning is same. Whether you call typhoid fever or enteric fever. Say the symptoms. When it is present in blood, na, I told you it is present in blood. When it comes in the blood, it causes fever. So first symptom is fever, but fever is very unique. Fever is not static. It is known as step ladder fever. You will say, ma'am, what is the step ladder fever? Patient will come to you saying, doctor, I am having 99 degrees Celsius fever. On the next day, patient say 99.5. Next day, patient say 100. Then next day, patient say 100.5. So this pattern This gradual rise is known as step ladder. It is looking like a ladder. That's why it is known as step ladder pattern fever. Okay, not only this, it goes in the skin and cause rash in the skin. It is known as rose spot rash. Appreciate the rose spot rash. The rash is rose spot. Not only this, when it is in the intestine, it causes longitudinal ulcer. I insist the word longitudinal. Mind it. It is longitudinal. It's not transverse. Okay, it is longitudinal. Lambe. Longitudinal ulcers are there. Okay, got it. So longitudinal ulcers. Now there are two types of ulcers. You can see these are transverse ulcers and these are longitudinal ulcers. Longitudinal. See the long axis. You will appreciate. These are transverse and these are longitudinal. In typhoid, we have longitudinal. So where we have transverse ulcers are in TB. You get this question, image-based question, especially in your competitive exams. So transverse ulcers are seen in TB. Okay, and longitudinal ulcers are seen in typhoid. So ma'am, how to learn it? I will forget in the exam. T. I'm having a way. Okay, we wear tie. Do we wear tie? Yes, we wear tie. So we wear tie like this or like this? Of course, we wear tie like this. We tie a tie. Collar tie like this. Okay, this is the tie. So tie se yaad aayega tie. Typhoid. Now you will never forget. Longitudinal ulcers. This is a way to learn it. Okay, typhoid have longitudinal ulcers and the TB is having the transverse ulcers. I hope you got it. Okay, so that is the symptoms. Apart from that, CNS sometimes it enters in the brain and involves the CNS, salmonella, and it causes muttering delirium. And it can cause hepatomegaly, splenomegaly. It can enter the heart and cause bradycardia, and it can cause longitudinal and intestinal ulcer. I already taught you. So these are the symptoms. The name of the disease is this, under which patient presents to you with these symptoms. So we are done with clinical features. Okay, now coming on lab diagnosis. What you will do for lab diagnosis? I'm having a question for you. Listen my question first. Let me see who is answering it. Listen my question first. It's difficult. It's tricky, not difficult. This patient is coming to me. Okay, patient is saying that doctor, I'm having step ladder fever. From the pattern of the fever, I found out the patient is having step ladder fever. The patient is having rose spots. Okay, the patient is having intestinal pain, intestinal ulcers, and I'm having strong suspicion that this patient is having typhoid. And there is a history of eating pani puri roadside, maybe fecal route. Okay, so I'm having a strong suspicion that this patient is having typhoid. I want to confirm it. It is my suspicion. I'm not sure. Okay, I want to confirm it. So my question to all of you. What sample should I collect? Listen it first. Shall I collect blood sample in a test tube and test the antigen in that? Shall I collect the blood sample in a test tube and test antibody in that? Shall I collect the stool sample in a container and test antigen in that? Shall I collect urine sample in a container and test antigen in that? In everything it can be present. It is obviously coming in the blood. You know the pathogenesis, you know the life cycle. It is coming in the blood. So in the blood, antigen can be present. When it is coming in the blood, body will make antibodies. Antibodies against O, antibodies against H. So we can test antibodies also. It is coming in urinary bladder. So it will come in urine also. It is present in the intestine causing longitudinal ulcers. So it will come in the stool also. Say, ma'am, all are right. We can collect all. So shall we collect all? Patient ko likh do, all. Do a stool test also. Do a urine test also. Do a blood test for antigen. Do a blood test for antibody, that is Vidal. No. We cannot do so. We have to be judgmental. So, okay, so what is the answer here? Does anyone know the answer? It depends on the time of presentation. When patient is presenting to you. So if the patient is coming to you in the first week of the fever, okay, you have to collect the blood sample for antigen. If the patient is coming in second week of fever, you have to collect the blood sample for antibodies. Here, blood sample for antigen, blood sample for antibodies. Blood for antibodies is known as Vidal. In Vidal, we test anti-O and anti-H. We don't test antigen, I told you. Okay, if the patient is coming in the third week, okay, you have to collect the stool sample. You don't have to collect blood. And if the patient is coming in the fourth week, you have to collect the urine sample. So there is more probability you will get the bacteria in the urine in fourth week. There is more probability you will get the bacteria in the stool in the third week. There is more probability you will get the bacteria in the blood in the first week. In the second week, you will not get bacteria in the blood. You will get antibodies against the bacteria in the blood. So there is a probability, and the mnemonic is BASU. B-A-S-U. First week, second week, third week, fourth week. B stand for blood culture. A stand for antibody. Antibodies are also in blood. Blood culture may we are testing antigen in blood. Okay, antibodies, that is Vidal. This test is Vidal. So we perform Vidal in second week. Don't you forget. Don't you dare to forget that. Okay. Third week we test stool culture. Fourth week we do urine culture. So please learn the mnemonic BASU, BASU. I hope you got it. Okay. So take the sample. You can do blood culture. You can do urine culture. You can do stool culture. Blood culture in first week. Stool culture in third week. And urine culture in fourth week. Okay. You can do antibody detection, that is Vidal, in the second week. Yes or no? Apart from that, you can do biochemical reaction. What were the biochemical reaction? Can we revise it quickly? COICU. What is the answer of COICU? Only C is positive, rest all are negative. I told you. Yes or no? And after that, we can do antigen detection and we can do PCR in all of them. The most specific test is PCR, but it is costly. So we don't usually perform it. We do the diagnosis based on these. So that is the lab diagnosis. What is the treatment? Learn only drug of choice. Don't learn the schedule. Don't learn the doses that you will do in medicine. Here you have to learn DOC. That's it. That's it. In microbiology, learn DOC. DOC is third generation cephalosporin ceftriaxone. Okay, this is a newer DOC. This you have to learn. We are done. Prevention. Vaccine is available for salmonella, for typhoid. How many of you are vaccinated? The people who are fond of pani puri, they should be vaccinated. Huh? So vaccine, 3 types of vaccine is available. What are the 3 types of vaccine? VI-CPS, the first vaccine. I will tell you the full form. VI-CPS, it is VI capsular antigen. VI capsular, CP is capsular antigen. So VI, what is VI? VI is present on the envelope. You will say, ma'am, there is no capsule. I know there is no capsule, there is envelope, but we call the envelope capsule here. It's a misnomer, you can say. So VI capsular antigen. Okay, the second is VI. Again, we take VI. And we conjugate the VI with recombinant Pseudomonas aeruginosa exotoxin A. Recombinant Pseudomonas aeruginosa exotoxin. Say the full form. Recombinant Pseudomonas aeruginosa exotoxin. So VI REPA. VI REPA. You can learn like that. You should know the full form. And third is typhoidal. Typhoidal. So this one is intramuscular. This one is also intramuscular or subcutaneous, but this one is oral. Tablet form में vaccine आता है. The vaccine is in the form of the tablet. See the 3 vaccine. See, this one is intramuscular or subcutaneous. Okay, this one is only intramuscular, but this one is oral. 4 tablets have to be taken alternate day. Day 1, day 3, day 5, day 7. 4 tablets has to be taken. So day 1, day 3, day 5, day 7, 4 doses. Here 2 doses, 4 weeks apart. Here single dose. So this is the schedule. This is the route. This is the composition. 3 vaccine. What are the 3 vaccine? VI-CPS, VI-REPA, okay, and typhoidal. Say the full form of VI-CPS. Say the full form of VI-REPA, huh? And say typhoidal. Say their route. Say their composition, and say their schedule. We are done. I guess we are done with the first bacteria. Now from second bacteria onwards, I will increase my speed. First, you give your experience. How you did you understood it? So this is my way of teaching the entire systemic microbiology in the form of master charts. Best to be combined with the master charts. So you can best combine this course if you make master charts with me. Then this course is very useful for you. Okay. So can we continue? Can you fill it with me? Quickly, very quickly. Introduction में Salmon and Smith are the scientists who discovered it. Okay, morpho में it's a gram-negative bacilli, capsule negative, spore negative, but motility positive. Peritrichus flagella, except Gallorum pullorum. याद आया? Culture में I will say 3 culture: DCA, XLD, and BBSA. I assume you know the full form. I assume you know the color of colonies and images of each of them. Tell me the enrichment growth. The enrichment growth is selenite F growth, tetrathionate growth, and gram-negative growth. So these are the liquid media. These are the solid media. Come on the biochemical reaction. Biochemical reaction is COICU. Positive, negative, 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 negative. Okay, antigenic structure. Quickly. So we have 3 antigen. O on the cell wall, H on the flagella, and VI on the envelope. But it is misnomerly called as capsule. But VI on the and the antigenicity is HOBI. Don't you forget it. Okay. Mode of transmission. It is feco-oral. Mode of transmission feco-oral. Clinical feature 1 disease. The name of the disease is typhoid fever or enteric fever. Symptoms you know. Stepladder fever, rose spots, longitudinal ulcers in the intestine, muttering delirium, you know. Okay, that is the symptoms. Lab diagnosis में BASU, BASU, first week, second week, third week, fourth week. Drug of choice is ceftriaxone. Vaccine में 3 vaccines available. You know the name of the 3 vaccine. VI-CPS, VI-REPA, Typhoidal. In just one, you can check. 1 minute, we have revised it. Likewise, we will revise all 60 bacteria in 1 minute if you have completed the systemic microbiology. Likewise, how many of you got it? Give me a thumbs up, everyone. You liked it? Okay. So can we go ahead now? Can I move on the next bacteria? Similarly, we will keep on revising. So people, I request you now, take out your notebooks. Why don't you take out your notebooks? Take a big file, big notebook, and make columns like this. Make rows like this. Count how many I'm having. I'm having 10 rows. I'm having 2 columns. You duplicate it, na? You just write it. If I can write, why can't you? You just write it like this. You will be ready with your master chart by the end of this course after 7 days. The complete master charts will be with you. 60 pages master chart. Your own handwritten. And that will be the gold. Believe me. Coming on the next bacteria. Quickly. Rickettsia. My second organism today. Let's start Rickettsia quickly. Okay. Now Rickettsia. Rickettsia. Introduction. The unique feature of Rickettsia. It can't stay outside the living cell. Like viruses. Yesterday I taught you viruses now. It is obligate intracellular bacteria. It's a bacteria, but it behaves like virus. It is a bacteria which is something between bacteria and virus. Actually, it's not completely bacteria, it's not completely virus. So the most of the properties are like bacteria, but one property is like virus. What's that? It's always intracellular, inside another bacteria, another living cell. It always lives inside living cell. Okay. So it's an obligate intracellular organism. Once it was thought to be a virus, but later on we found that no, it's a bacteria only. Some properties are like virus. Okay, that is the introduction. And it targets the endothelial cell. The target is endothelial cells of the blood vessels. That is the target of Rickettsia. There are 6 types of Rickettsia. I will teach you all 6. All 6. By Rickettsia, I mean 6 Rickettsia. By Salmonella, Typhoidal Salmonella, I mean 4 bacteria. You know the name of the 4. Now I will tell you the name of the 6. 6 Rickettsia over here. Okay, introduction. Morphology. I told you, na, I don't learn morphology. You tell me where it is coming. In the gram staining. So here is Rickettsia. It is coming in miscellaneous. Yesterday I taught you this. You were present yesterday. Why it is miscellaneous? Why it is not gram positive or gram negative? Why it is not cocci or bacilli? It is poorly gram stained. It is poorly gram stained. We don't use gram stain in these 4 miscellaneous. We use Giemsa stain. That's why it is in miscellaneous. Learn this classification, without which you are not allowed to attend my class. You have to learn this. I'm very peculiar. Okay, got it? Chalo. So gram stain it's poorly gram stained. That's why we have to use Giemsa stain. Capsule spore motility, don't learn it, people. Mathematics, apply it here. This mnemonic capsule, this mnemonic spore, this mnemonic motility. Bacteria is Rickettsia. Rickettsia coming here? No. Rickettsia coming here? No. Rickettsia coming here? No. So you can see negative, negative, negative. No need to learn. Learn the mnemonics. Got it? So morpho is done. Okay, coming on culture. So since it cannot grow outside the cell, how it can be cultured? What is a culture? Yesterday I taught you culture. Basal media, special media, 6 types of special media. Enriched media, enrichment media, well many, transport media. I told you all yesterday, na? Yes or no? I told you, na? But they all are acellular. So a culture media contain agar. Okay, liquid one don't contain agar, but they don't contain cell. The culture media are acellular. They don't contain cell in them. They are acellular. So if you try to grow Rickettsia in them, if you try to inoculate Rickettsia here or here, since they don't contain cell, how Rickettsia will grow? Because my first line for the Rickettsia, it's the obligate intracellular organism. It cannot be cultured. It cannot be cultured. Got it? This is the reason. It cannot be cultured. So no cell active media. So then how to isolate it? I want to isolate. So you have to give the living medium. The culture media are non-living. You have to give a living medium. So provide an embryonated egg inside the egg. In the membranes of the egg, it can be grow like viruses. Or inside an animal, the living animal like mice. Or inside the cell cultures like the viruses. This is how we can isolate it like the virus. Got it? So that is the culture. Next heading is antigenic structure. It is having 3 important antigens on it. What were the 3 important antigens in Salmonella? O on the cell wall, H on the flagella, and VI on the envelope. Yes or no? Here also we have 3. Okay, what are the 3? They are present. They are lipopolysaccharide. They are not present on cell wall. They are not present on flagella. Okay, on the cell wall only you can say. On the cell wall, on the lipopolysaccharide they are present. The 3 antigens. What is the name of the 3 antigens? 3 antigens are there. OX19, OX2 and OXK. What is the name? This is the basis of Weil-Felix reaction. I will tell you Weil-Felix reaction next in the lab diagnosis. So OX19, you can see OX19, OX2, OXK. These are the three antigens present on the cell wall, you can say. Cell wall. O means cell wall, no? O. All three are the types of O. The three types of O. O means somatic antigen. But they are the types, different three types. OX19, OX2, and OXK. And this is the basis of Weil-Felix reaction. What is Weil-Felix reaction? I will let you know in the lab diagnosis. Okay. In Salmonella, we have Vidal. In Rickettsia, we have Weil-Felix. Mode of transmission is not eating. It is not sexual contact. It is not inhalation. It is not skin penetration. It is the bite of the vector. The vector can be louse, flea, tick, mite. For 6 different Rickettsia, 6 different vectors are there. I will let you know. But the mode of transmission is the bite of the vector. Bite of the vector. I will tell you the vector. Now coming on the clinical features. In clinical features, first, people, every year question comes in INI-CET and NEET PG from this table. Every year. And in university exams also, it's very important. Please focus. Okay, it's difficult, but I will make very easy for you. Listen. So there are six type of Rickettsia. I will help you in learning this table in just 1 minute. You focus here. First of all, you make a sequence of this. You don't change the sequence. You make a mnemonic and learn the sequence of the 6 bacteria. What are these 6 bacteria? Read it. So first is Rickettsia provozaki, known as RP. Second is Rickettsia typhi, known as RT. Third is Rickettsia rickettsii, known as RR. Fourth is Rickettsia conori, RC. Then Rickettsia akari, RA. Then Orientia susugamushi. Don't read it tissue. T is silent. Read it susugamushi. So Orientia susugamushi. Now how to learn it? In a sequence. I'm having a mnemonic for you. The mnemonic is PT Usha. Have you heard PT Usha? PT. Don't write Usha. Write down PT. PT Usha run. Usha man mein bolo. PT Usha run. Calcutta trophy. Or you can learn CAT cat. Okay. So PTR CAT. PT run Calcutta trophy or PT run CAT, whatever. Okay. This is Rickettsia provozaki, Rickettsia typhi, Rickettsia rickettsii, Rickettsia conori, Rickettsia akari, Orientia susugamushi. Don't you dare to change the sequence. Okay. If you learn the sequence, the rest of the table will be fun for you. Okay. Now tell me the disease they are causing. They all cause one disease. You have to learn the name of the disease. So learn Rickettsia provozaki cause epidemic typhus. Provozaki cause P. Match the P. Provozaki cause epidemic typhus. Okay, the next typhi causes endemic typhus. You can learn ENT. E-N and T. ENT is a subject now. So typhi causes endemic typhus. This is epidemic typhus. This is endemic typhus. And there is one more typhus, crop typhus. There are 3 types of typhus. So Orientia susugamushi causes crop typhus. So learn the 3 types of the typhus first. Then learn R for R. Rickettsia rickettsii cause RMS. What is RMS? Rocky Mountain Spotted Fever. R for R. Rickettsia rickettsii causes RMS. Okay, the next is, have you seen a globe? On globe, where is India? India is in a corner on the globe. It's just for the sake of learning, I'm telling you. So where is India? India is a corner. Okay, so Rickettsia conori. Conori se, kone se, corner se mujhe yaad aata hai India. So it causes Indian tick typhus. So conori, Indian tick typhus, IIT. Indian tick typhus, ITT. Okay, akari. What is akar? Akar means shape. Okay, have you seen viruses? Viruses have beautiful shapes. I will tell you all viruses also. Bullet shape, brick shape, space vehicle shape, satellite shape. They have beautiful shapes. So from akar, I remember virus. What is the most important virus? Chickenpox wala. So it is rickettsial pox because it resembles chickenpox. That's why it is known as rickettsial pox. A way to learn. This is how you have to learn the name of the bacteria and you have to learn the name of the disease. Can we revise it quickly? Fatafat. T, Usha, run, CAT, cat, Rickettsia provozaki, Rickettsia typhi, Rickettsia rickettsii, Rickettsia conori, Rickettsia akari, Orientia susugamushi. Chalo. Tell me the name of the diseases quickly. This causes epidemic typhus. This causes endemic typhus. And this causes scrub typhus. First you finish the 3 typhus. Then R for R. Rickettsii causes RMS. Rocky Mountain Spotted Fever, RMSF. Okay, Kona, corner, India, ITT, Indian tick typhus. Okay, Indian tick typhus. Akar, shape, virus, chickenpox, rickettsial pox. So here you remember Rickettsia pox. This is how I learned. However you want to learn, but do learn. You can't skip it. Okay, so this is done. Now, coming on the vector. They all are due to vector bite, na? Name the vector. Name the vector. So if you don't change the sequence, just learn the sequence. Sequence is very funny and very easy. It's louse. Say louse. Say it louder. If you are alone, not in a library, you can say it louder. Louse. Flea. Louse. Flea. Tick, tick, mite. Louse, flea, tick, mite. I will say. Louse, flea, tick, mite. Okay. So it's very easy to learn. First louse, second flea, then 2 times tick, then 2 times mite. This is adult mite. This is larva of mite. The larva of mite is known as shigar, and that's why this is known as shigerosis. Scrub typhus also known as, write down, shigerosis, because it is known as shigar. The larva of the mite is known as shigar. Okay, got it? Now in all of them, rash is there. Let me show you rash. In all of them, what is the symptom? In all of them, only 2 symptoms, fever and rash. So based on the rash, we can differentiate them. Suppose a patient is coming to me. So based on the rash, I can differentiate which one is it. Which one is it? Based on the rash. Rash is peculiar. You have to learn rash. You will get a clue from the rash in your exam question. Okay. So in Rickettsia provozaki, epidemic typhus, rash is everywhere except palm and sole. Except palm and sole. Rash is everywhere except palm and sole. Okay. In the third one, okay, here trunk followed by extremity. Here trunk and extremity. So in both of them, trunk and extremity. Here everywhere except palm and sole. Here trunk and extremity. Here trunk and extremity. Okay. Here also trunk and extremity, but the rash is ischar. Ischar means black color rash. Okay. Here vesicular. What is vesicular rash? The rash of the chicken pox. It is the vesicle containing fluid. Okay. It is vesicular rash. The rash of the chicken pox. The rash of the herpes. And here it is ischar. Again ischar. So ischar is here and ischar is here. So this is how in the sequence you have to learn the rash. Last is Weil-Felix. How you differentiate them based on the Weil-Felix. See the images of their vectors. This is louse. This is flea. This is tick, mite, and mite. This is adult mite. This is the larva of the mite. The larva of the mite is known as shigar. People in your INI-CET NEET PG, you get image based question. Now you take this question from microbiology, it's your choice. You take this question from PSM, entomology, environment wala chapter, it's your choice. But this question comes in your exam very frequently. So you have to learn the images of the vector. See, louse looks like this. Flea, tick, adult mite, larva of the mite. Okay, got it? Yes or no? So you have to learn. This is a rash. Now tell me, I told you there are 3 antigens on its surface, na? OX19, OX2 and OXK. Not all Rickettsia have all 3. And that is the basis of Weil-Felix. So which one is having which? I will draw it. Everyone on the screen. Everyone on the screen. Listen. P, T, Usha, Run, Calcutta, Trophy. Rickettsia provozaki, Rickettsia typhi, Rickettsia rickettsii, Rickettsia conuri, Rickettsia akari, Orientia susugamushi. Got it? Now tell me which antigen which one is having. The first 2 have OX19 on them. Very easy. The first 2 have OX19 on them. The first 2. You know which one. The next two. Along with OX19, they have OX2 also. Along with OX19, they have OX2 also. The 5th one, none of the 3 antigen. Akari don't have any antigen, the 5th one. And the 6th one, Susugamushi, have OXK. Okay, so body will make antibodies against them, and that is Weil-Felix reaction. This is the basis of Weil-Felix reaction. I hope you got it. I'm trying my best, Yes or no? Say, so see the Weil-Felix reaction, the results of the Weil-Felix. The first 2 have OX19. Say yes. The next 2, along with OX19, OX2. Say yes. The 5th one, all negative. And the last one, only OXK. So we are done with the clinical features. The 6 bacteria, with the 6 diseases, with the 6 vectors, with the 6 rash, with the 6 lab diagnosis. People, it was a very big job. Give me a thumbs up. No, not now. We will fill it. Then you give me a thumbs up. Can you help me in filling, please? Can you help me in filling? Chalo. We will fill this table together. Everyone with me. Everyone. Say. So what is the bacteria? First you say the 6 bacteria. What is the mnemonic? P, T, Usha, Run, Calcutta, Trophy. Say the full form. Rickettsia provozaki, Rickettsia typhi, Rickettsia rickettsii, Rickettsia conuri, Rickettsia akari, Orientia susugamushi. Say the diseases, people, quick, fast. This one is epidemic. This one is epidemic typhus. This one is endemic typhus. And the last one is crop typhus. Okay, R for RMS. कोने से याद आता है इंडियन tick typhus. और आकार, virus. So rickettsial pox, chicken pox, rickettsial pox. This is how you have to learn. Tell me the vector. Very funny now. Vectors, huh? Louse, flea, tick, mite. Louse, flea, tick, mite. But this one is the larva of the mite. That is shigar. And that's why it is shigerosis. You already know that. Okay. Now tell me the rash. Rash everywhere except palm and sole. Rash on the trunk and extremity. Okay, but here the rash is having ischar. Okay, here rash is vesicular. And here also rash is having ischar. Okay, learn the pattern of the rash. Now coming on Weil-Felix. The last thing is Weil-Felix. The first two, only OX19 positive. The next two, along with OX19, OX2 is also positive. The fifth one, all three negative. And the last one, OXK positive. I hope it's visible to you. If it is, I am the obstruction, kindly see it. I'm going out of the scene. First, you learn this table. You have to. You can't skip it. Okay, we are done. Lab diagnosis, you can understand. After 2-3 bacteria, you will understand how to write lab diagnosis, how to understand it. So you can do the antibody detection like Weil-Felix. Vidal and Weil-Felix are antibody detection, not the antigen detection. So on the surface of this Rickettsia, if OX19 is there, body will make antibody against that. If OX2 is there, body will make antibodies against that. If OXK is there, body will make antibodies against that. So in Weil-Felix, we are detecting anti-OX19 antibody, anti-OX2 antibody, and anti-OXK antibody. We are not detecting antigen, like Vidal only. So Vidal and Weil-Felix are antibody detection, not antigen detection. Apart from that, we can do biopsy from the rash. Okay, we will get the bacteria and that. Apart from that, we can't do culture. They are not cultivable. We can do isolation on the cell lines like the viruses, and we can do PCR in all of them. So the lab diagnosis. What is drug of choice? Drug of choice is doxycycline. We are done. Okay, prevention, no vaccine available. Vector control. Okay, we are done. So can we revise the 2 bacteria, people? Out of the 21, 2 are done, 19 more to go. Say yes. Can we revise this one? Quick, fast. Chalo, Rickettsia. Obligate intracellular organism, once thought to be virus. That is my introduction. Morphology mein, it's it's miscellaneous, poorly gram stained. Use Giemsa stain. And capsule negative, spore negative, motility negative. Non-capsulated, non-spore forming, and non-motile. What about culture? No culture. Okay, isolation done either in animal or on cell line or on embryonated egg like the viruses. No biochemical reaction. Okay, antigen structure, 3 important antigen. OX19, OX2 and OXK. Present on the cell wall. Lipopolysaccharide antigen. Mode of transmission, vector bite. It's vector bite. Here it was fecal-oral. Here it is vector bite. Here it was O, H and VI. Here the 3 types of O. Okay, here biochemical reaction C, O, I, C, U. We were having something. Here no biochemical reaction. Here we have DCA, XLD, BBSA. Here no culture. Morphology here negative, positive. It was motile if you remember. But this one is all negative. Okay, this is how. And here introduction we have a scientist. Here we don't have any scientist. So please compare, please contrast. Lab diagnosis mein here main test is Vidal. Here main test is Weil-Felix. In both of them we are detecting antibodies against the organism, not the antigen. Okay, clinical feature mein name of disease. Here is typhoid. And you know the symptoms of the typhoid. Yes or no? Stepladder fever, rose spots, longitudinal ulcers, you know that. Here we have 6 bacteria, 6 diseases, 6 vector, 6 type of rash. That is the clinical feature. You know that table. PT Usha run Calcutta trophy. You can't forget that. Oh, here only 1 disease. But here we are having 6 disease. Treatment mein ceftriaxone. Treatment mein doxycycline. Vaccine. 3 type of vaccine available. Yes, available. You know the 3 type of vaccine. VI-CPS, VI-REPA and Typhoidal. Here no vaccine available. Write down the negative finding also. We are done. One of the 2 biggest bacteria I have done. And we have revised them in just 1 minute. Okay, yes or no? Appreciating? Can we go ahead? Chalo. So let's start the 3rd bacteria quickly. Now you grasp the speed and you understood my pattern. If you are liking my pattern, we will continue. Can I come on the third bacteria? The third bacteria is Brucella. The third bacteria is Brucella. Salmonella is done. Rickettsia is done. Now Brucella, Leptospira and Borrelia. So we will be done with bacteria. We'll come on viruses quickly. So Brucella. Okay, Brucella, Bruce isolated it. And that's why it is called as Brucella. We have honored the scientist. The name of the scientist who discovered it is David Bruce. It's a zoonotic disease. It's a disease of animal. It's not a disease of human. It cannot enter directly in human. It enters in human via animals. So it's a disease of the cattle. It's a disease of cow, buffalo, cattle. It's a zoonotic disease. Brucella. It's a zoonotic disease. It's a disease of animal. Which Brucella? There are three important species of Brucella. The most important is Brucella melitensis, Brucella abortus, Brucella suis, and Brucella canis. If you can't learn all four, learn one. Brucella melitensis. So that is the type of Brucella. Okay. Salmonella, Typhoidal Salmonella, I taught you 4 types of Salmonella. Rickettsia, I taught you 6 types of Rickettsia. And Brucella, I am teaching you 4 types of Brucella. You have to learn the complete names. Okay. Morphology, don't learn it. People don't learn it. Where is Brucella? You search it here. Kahan hai Brucella? Here is Brucella. You can see the classification. It's a gram-negative bacilli. No need to learn. No need to learn. It's a gram-negative bacilli. See my 3 mnemonics. Apply the Brucella. Is it coming in this mnemonic? No. In this mnemonic? No. In this mnemonic? No. So learn the morphology. Okay. No capsule, no spore, no motility. Okay. It's an obligate aerobe. Who was present yesterday? Tell me the mnemonic quickly. Tell me the mnemonic of obligate aerobe. Yesterday I taught you. Let me see who is telling. Tell me the mnemonic of obligate aerobe. Quick, fast. Yesterday I taught you. 4 organisms. Nesty, pest, must breathe. Obligate aerobe. Obligate anaerobe can't breathe there. Yaad aaya? Obligate aerobe is nesty, pest, must breathe. Nesty, pest, must breathe ka B. It is Brucella. It's the obligate aerobe. Okay. So it's the obligate aerobe. So morpho is done. Coming on culture. Tell me the selective media. The selective media is Castaneda biphasic media. It contains both as well as agar. It's solid as well as liquid. Both media. You can see it contains agar ka slope. This is agar. And it contains broth also. Okay, so it's a biphasic media. It's solid as well as liquid. It's a double biphasic media. Name of the media is Castaneda. Castaneda biphasic media. Okay, what does it contain? It contains brain heart infusion, BHI. Okay, it is broth also, agar also. So this is a unique media on which only this Brucella will grow, others will not grow. It contains the stimulatory substance for Brucella and inhibitory for others. So what is the name of the culture media? Say it with me, learn it with me, people. Learn it with me. Castaneda biphasic media, brain heart infusion. Chemical properties. Okay, here we have only catalase, oxidase and urease. Okay, so CO. Okay, and among ICU only U is positive. You can write down all 5 if you wish. So C is positive, O is positive and U is positive. I and C is negative. If you want the completion, my mnemonic is COICU. So okay, there only C was positive, rest all were negative. In typhoid, in Rickettsia, we don't have biochemical reaction because they can't grow extracellular. Okay, but here the mnemonic is positive, positive, negative, negative, positive. You have to learn the sequence. So COICU, positive, positive, negative, negative, positive. You learn the sequence. So this is biochemical reaction. Antigenic structure on the surface of the bacteria. We have 2 antigens on the cell wall. We have M antigen and A antigen. We don't have O, we don't have VI, we don't have H, we have M and A antigen. Brucella, M and A antigen, which are not very important. Now what is the mode of transmission? Mode of transmission is very unique. The first bacteria I taught you, typhoid, mode of transmission, fecal ingestion. The second bacteria I taught you, Rickettsia, the mode of transmission was vector bite. Louse, flea, tick, mite, the bite of all these vectors. Okay, and the third I am teaching you Brucella. Brucella cannot enter directly in human. It enters via animals. So imagine a human who is in close contact with animals, like the farmers, like the butchers. Okay, so these are at high risk. You can see farmers, shipyards, goathers, butchers, abattoir workers, veterinary doctors, lab workers who are in close contact with the animals. You can appreciate the farmers, the butchers. That's why they are at high risk. Because the most important route is direct contact with the animal. Okay, or someone is eating the animal who is contaminated. Either direct contact with the animal, touching the animal, or eating the contaminated animal. Okay, touching the animal, eating the animal, inhaling the animal. I mean close contact in the animal and inhaling the droplets coming out of the animal. So inhaling, okay, and human to human is via blood transfusion or breast milk. Human to human is only via blood transfusion or breast milk, which is rare. So it is mainly via animal. So direct contact with the animal, eating the animal, or inhalational. So these are the routes. Please mind the routes, and these people are at high risk. So you get typical question. There is a farmer presenting with blah blah blah. There is a butcher presenting with blah blah blah. So farmer, butcher, veterinary doctor, these are the risk factors. Okay, occupational risk hazard. Now the name of the disease. What is the disease it is causing? The name of the disease is brucellosis. It is not written here. You can write down brucellosis. Okay, it is having 3 symptoms. Triad. 3 symptoms. Patient comes with fever. What is the pattern of the fever? Okay, patient say fever comes, automatically goes down without treatment for some days. After some days again it comes, automatically goes down for the next few days. Again it comes, again it goes down. This fever is known as undulating fever. What is known as undulating? Remember the pattern of the fever in the typhoid? It was step ladder. Okay, and here it is undulating. So pattern of fever is very important, people. Here it is undulating fever. Undulating fever, okay, it is known as undulating fever. You write down undulating. It was first discovered in Malta island of the Mediterranean region. That's why also known as Malta fever, also known as Mediterranean fever, also known as undulating fever. Number 2, arthralgia, pain in the bones, arthralgia. And number 3, hepatosplenomegaly, hepatosplenomegaly. So learn the triad: undulating fever, Malta fever, Mediterranean fever, whatever you say, arthralgia, okay, and hepatosplenomegaly. That is a triad of brucellosis. Learn the disease, learn the symptoms. Okay, lab diagnosis, what you will do? What you will do in the lab diagnosis? See, in all lab diagnosis, one main test is there. You have to highlight that test. Like in Salmonella, the main test is Vidal. Learn BASU. In Rickettsia, the main test is Weil-Felix. I told you the pattern of all 6. Here the main test is CET. I will tell you what is CET. Standard agglutination test and 2ME-CET. This is the main test. So standard we will do culture. Culture काय में करोगे? What is the culture media? Castaneda. Castaneda biphasic brain heart infusion. Biochemical reaction I told you, na? COICU. Positive, positive, negative, negative, positive. Learn the pattern. Okay. And PCR you will always do. In PCR there are some unique genes you can focus if you want to learn for your MCQs. These are the unique genes. These are the unique genes present only in Brucella, not in any other bacteria. So you can target these genes in the PCR for your MCQs if you want to learn the genes. Okay. Now serology mein the unique test here is SET. What is the full form of SET? Standard agglutination test. Okay. What is standard agglutination test? It's simply agglutination test. I guess you know what is agglutination. I will tell you in immunology. What is agglutination test? We take 7 test tubes. Can you see? We are taking 7 test tubes. In all of them, I am putting externally available Brucella antigen 1 unit. Okay, it's available commercially in my laboratory. So I am adding the antigen, Brucella antigen in all of them, 1 unit. Externally, 1 unit in all of them. Okay, I am adding in all of them. Please understand if you want to. Nobody is going to ask the principal, but for your understanding, I am telling you. So I am adding 1 unit of Brucella antigen in all of them, all the 7 test tubes. Okay, now I am taking the patient's serum, not patient blood. I am taking the patient serum. Serum contain antibody. Now the patient serum contain antibody against the Brucella. Okay, now I am doing serial dilution. Here I will put 1/10. Okay, here I will half it 1/20. Here I will half it 1/40. Here I will half it 1/80, 1/160, like that. Okay, I will keep on halving. Okay, and this is known as serial dilution. Okay, antigen is present equally in all of them, but antibody, the antibody we are halving. We are halving the antibody in all of them. That is known as serial dilution. You know, zone of equilibrium, zone phenomenon in agglutination, in precipitation, and zonation. So here, whenever antigen antibody will be in proportion, agglutination will happen. And the first test tube, the last test tube in which agglutination happens, it is known as titer. So this is how you carry it out. You can see, I can see agglutination here, but not here. So my titer is 1/80, like that. Okay, so we calculate the titer. Please don't go in the details. Nobody is going to ask you the procedure steps. For your understanding, I told you this. Okay, now listen. What is the question? You focus that. Now in SET, what we are detecting in this test, हमें पता क्या चल रहा है? In this test, we came to know that patient sample contain antibody, yes or no. If SET is positive, the antibody is present. If SET is negative, antibody is absent. So it is a test of detection of antibody in the serum, like Vidal, like Weil-Felix. In SET also, we are detecting antibodies. We are not detecting antigen. in Vidal also, in Weil-Felix also, in CET also. We are detecting antibodies. Acha, which antibodies we are detecting? IgM or IgG? Say, ma'am, both. Whatever antibody is that, okay, that will do the agglutination. So CET detect both. CET detect IgM and IgG both. It cannot differentiate. Okay, but there are two types of brucella. Acute brucellosis and chronic brucellosis. In acute brucellosis, IgM is positive. And in chronic brucellosis, IgG is positive. Okay, suppose you are a clinician and you have sent a sample to me and you are calling me, madam, I have sent a sample to you. Okay, there is a farmer. The sample is of a farmer and the farmer is complaining undulating fever, bone pain and hepatosplenomegaly, and I am having a strong suspicion that the farmer is having brucellosis. Can you please test it for me whether my suspicion is right or wrong? So I have heard the history. I will say, yes sir, yes ma'am, definitely I will do so, and I will apply the CET. Suppose CET is positive. I am calling you again. Yes, doctor, sir, ma'am, the CET is positive. So your suspicion is right and the person is having brucellosis. Your next question to me, ma'am, is it acute or chronic? I will treat the patient accordingly because the treatment of both is different. The prognosis of both is different. So can you tell me, is it acute brucellosis or second chronic brucellosis? So based on CET, I cannot tell. Based on CET, I cannot tell. CET positive माने brucellosis. भाई अब वो acute है कि chronic मुझे नहीं पता. I don't know whether it is acute or chronic. CET is positive माने brucellosis. Okay. If you want to know whether it is acute or chronic, you have to apply one more CET. That is known as 2-ME-CET. There is a chemical available. The name of that chemical is 2-mercaptoethanol. M-E, mercaptoethanol. M-E, mercaptoethanol. The property is that 2-ME kill M, IgM. M kill M. What I am saying? M kill M. Okay, again take 7 test tube. Again take 7 test tube. Now in all these, first you put Brucella antigen, which is commercially available in my laboratory, 1 unit. Brucella antigen. Okay, before you put the patient serum, you put 2-ME. 2-ME in all of them. Okay, this is 2-ME. I am putting 2-mercaptoethanol also in all of them. In all of them, 1 unit. So 1 unit Brucella antigen, 1 unit 2-mercaptoethanol. Now I will take patient ka serum. This is patient ka serum and I am doing the serial dilution. I am doing the serial dilution in all of them. Now, if the patient's serum contains IgM, that will be killed here. That will be killed by 2-mercaptoethanol. Oh, so if still it's positive, it's because of IgG. And now if it become negative, it was due to IgM. So 2-mercaptoethanol CET differentiate acute and chronic. I hope you got it. I hope you got it. So if CET is positive, in both of them CET is positive, mane patient have brucellosis. Now I want to differentiate, is it acute or chronic? So I will apply 2-ME-CET. I will apply 2-ME-CET here. I will apply 2-ME-CET. You know how to apply. Only one step is additional. 2-ME-CET in both of them. Now if 2-ME-CET is also positive, okay, so it is due to IgG. It is due to IgG. So this one is chronic brucellosis. Okay, but if 2-ME-CET become negative now, this was positive, but this become negative. So this positivity was due to IgM. That is killed by 2-ME. Okay, and this is acute brucellosis. So if CET positive, 2-ME-CET both positive, it's chronic. But if CET is positive, 2-ME-CET is negative, it's acute. Okay, समझ में आया? अच्छी बात है. नहीं समझ में आया? Double अच्छी बात है ना? Just learn it. Learn the summary. You have to learn the summary. Got it? So I mean, if both of them are positive, it's chronic. If the first is positive, second is negative, it's acute. So that's the summary. I tried my best to explain you all though. How many of you got it? How many of you got it? Say. Okay. So that is the lab diagnosis. Drug of choice, gentamicin plus doxycycline. Learn this combination. That's the drug of choice for brucellosis. Okay, prevention, vaccine is available. Okay, the name of the vaccine is Brucella abortus 19A, 19BA vaccine. Brucella abortus 19 vaccine is available and it is a live attenuated vaccine, but not frequently used. But this vaccine is available. Who should be vaccinated? The farmers, the shipyards, the people who are in close contact with animals, they should get vaccinated. So vaccine is available. We are done with Brucella. Fill it quickly in just 1 minute. Brucella is done. Brucella is done. Can I move on the next bacteria quickly? Now you got my pattern. My fourth bacteria is Leptospira. Leptospira and Borrelia, both are spirochetes. Both of them are spirochetes. I guess there are 3 spirochetes, everyone know. Trypanoma, Leptospira, Borrelia. Trypanoma, I will teach you in sexual STDs. Okay, I will teach you in genital infections. And the Leptospira and Borrelia I am teaching you here. Okay, so there are 3 spirochetes. 2 will be dealt in CVS and 1 of them will be dealt in genital. Got it? So let's start Leptospira. My next bacteria is Leptospira. Leptospira is a type of spirochete. Of course, it's a type of spirochete. How many types of spirochetes? Trypanosoma, Borrelia, Leptospira. I'm teaching you Leptospira. Leptospira is also zoonotic disease like Brucella. It is acquired from animals. I will tell you which animal. Rat. Here, not cattle. Brucella is acquired from cattle, cow, buffalo. But this one is acquired from rat, chuha, rat. Okay, but it is also zoonotic disease. Okay, here two important species are there. Leptospira enterocans. This one is the main species. And Leptospira biflaxa is non-pathogenic. It is not pathogenic in humans, so don't learn that. Learn one species here. Leptospira enterocans. Learn the full forms. Brucella. In Brucella, I told you 4 species. Most important is Brucella mediterraneanus. The other 3 also you have to learn. Brucella abortus, Brucella swiss. Please learn them. Here I told you 2 species. The important is Leptospira enterocans. Okay, so Leptospira enterocans. Okay, so that is the introduction. You can see. Morphology, we don't learn morpho. So where is Leptospira? Search. Where is Leptospira in this classification? Here is Leptospira in the end. I guess you can see it is hidden. Below the Borrelia, it is cut, I guess. So it is coming in miscellaneous. My point is that it's coming in miscellaneous. So it is not gram positive, not gram negative, not cocci, not bacilli. It is poorly gram stained. It is poorly gram stained. We usually use silver stain, okay, or ginsa stain. We don't use gram stain because it is coming in miscellaneous. What about capsule, spore and motility? Apply. What is my bacteria? Leptospira. Is it coming in this mnemonic? No, it's not capsulated. Is it coming in this mnemonic? No, it's not spore forming. Is it coming in this mnemonic? I think yes. It's coming. Search it where it is coming. It is one of the spirochete. Spirochete are motile. Spirochete are motile with polar flagella. They are motile with polar flagella. So motility is present. So Leptospira is non-capsulated, non-spore forming, but motile with the polar flagella. So apply the 3 mnemonics everywhere. So non-capsulated, non-spore forming, but motility is present with the help of polar flagella. Okay, and you can see they are the thinnest bacteria. You know, all the spirochetes, all 3 spirochetes, they are like thread. They are like thread. They are very thin. You can see it is tightly coiled with hooked ends. Leptospira. Appreciate the hooked ends. Learn the morphology. It is having a typical motility. I told you yesterday, the corkscrew motility. Yesterday I taught you 4 unique chal. If you have attended my yesterday's session, I told you what is darting. I told you what is tumbling. I told you what is swarming. And I told you corkscrew. So corkscrew motility is shown by the spirochetes. Okay, so it shows corkscrew motility. Morphology is done. Okay, after that culture, the selective media is EMGH. It is the name of the scientist. Don't learn the full form. If you wish, you can see. This is the name of the something scientist. I don't learn it. EMGH is more than sufficient. Learn the initials. EMGH media. Learn the name of the scientist if you wish. Okay, so that is the culture media, the selective culture media. What is the mode of transmission? Rat ki urine. This is rat. This is the urine of the rat. Okay, the urine of the rat is contaminating food and water of the human. The urine of the rat is contaminating the food and water of human, and some human is ingesting it. Okay, so that is the mode of transmission. Okay, the mode of transmission is urine and placenta of the rat. Okay, close contact with urine and placenta of the rat. So there is 3R. What is 3R? 1R is for rat. Rat mane rodents. Okay, you know rats are more frequent in rainy season. Nowadays we have rainy season. Rats are more frequent in rainy season, and rats are more frequent in the rice field. Chawal ke khet, rice field, rice paddies. They are more frequent. So we call it triple R disease. What is triple R? See the triple R. What is triple R? Rat, rain, and rice field. Rat, rain, rice field. It is a triple R. Okay, the mode of transmission is triple R. Never forget. What is the name of the disease it is causing? It is causing leptospirosis. What is the name of the disease it is causing? Leptospirosis. Leptospirosis have 2 spectrum. Either the disease is, in 90% of the people, disease is very mild. Kuch hoga hi nahi, very mild. Flu, sardi, khansi, zukam. Simple flu, very mild, nothing will happen. No treatment required. They will be treated automatically. Okay, but in 10% of them, the disease is very severe and it is known as Weil's disease. It is not Weil-Felix reaction. Weil-Felix reaction was in Rickettsia. Here it is Weil's disease. Weil's disease, which is very severe. Okay, and here liver and kidney mein hemorrhage will occur. It is known as hepatorenal hemorrhage syndrome. So liver, you can see liver and the kidneys. Liver and kidneys mein hemorrhage will occur. Okay, so hepatorenal hemorrhage syndrome. It's very severe, mortality is very high, person dies. So Weil's disease. And this one is anacteric, no jaundice. Here jaundice occur in Weil's disease. In Weil's disease, person have jaundice. It's acteric. Okay, jaundice. Here anacteric febrile illness, only fever, flu. So two spectrum, anacteric febrile illness and Weil disease. Both are coming under leptospirosis. If the person is lucky, 90% people have this. If the person is unlucky, 10% of them have this. No one can predict that after having leptospirosis, which person will have what. It is having two spectrum. One of them will occur in the person after leptospirosis. How does it is entering in human? Triple R. Triple R. Okay, got it. Lab diagnosis. Lab diagnosis is standard. You do microscopy. Here, because it is very thin bacteria, no? It is the thinnest bacteria, spirochete. So we don't use light microscope. We use dark field microscope. Dark field microscope. You may be knowing for the thin bacteria, we use dark field microscope. We use negative stain. Okay, so dark field microscope, it is seen as a spiral bacteria. Okay, culture we can do on EMGH. Animal inoculation, we can use hamster. We can take the patient sample and inoculate inside the hamster. If hamster have the same symptom as that of patient, the diagnosis is confirmed, but we don't use these techniques nowadays. We can do the serology. Serology means antibody detection. Okay, or we can do PCR. PCR means specific genes are there. This is just for your MCQ. Have a look. Don't try to mug up. For every bacteria, there is specific gene. Na? This is why I taught you blotting techniques. Every bacteria, every organism has some unique genes. Okay. So they can ask you the unique genes and you have to target that particular unique gene of that particular bacteria for doing PCR. But just read them casually for your MCQs so that in the option you can recognize that. Got it? So that is the lab diagnosis. Treatment. If it is mild, flu-like syndrome, okay, anacteric febrile illness, give doxycycline. But if it is Weil disease, it is severe. In Weil disease, give IV penicillin. So in this case, you give doxycycline. This case, you give IV penicillin. Just learn the drug of choice. People, prevention, no vaccine available. No vaccine. Prevention में, prevention from the rodents. Rodents के contact में नहीं आना है. Okay, rodents का urine का contact and placenta का contact. Don't come in contact with the rodents. Okay, so beware of rodents. That is the prevention. So we are done with Leptospira. How many of you got it? People, we can fill it in just 1 minute. We can fill this table in just 1 minute. Mind my words. You want me to fill? Chalo. Leptospira. Leptospira. Introduction, I told you, it is a type of spirochete. One of the spirochete. Morphology, I told you, it's poorly gram-stained. So we use silver stain. And it is non-capsulated, non-spore forming, but motility is present with polar flagella and corkscrew motility. Write down here only corkscrew motility. Okay, you can draw that also. Culture mein you can write down EMGH. If you wish, you can learn the full form also. Biochemical reaction mein something I told you. Biochemical reaction. I don't think I told you biochemical reaction. Antigenic structure, no important antigenic structure. Mode of transmission, triple R. You know triple R. Rodent, rain, rice field. Clinical feature mein leptospirosis. The two spectrum of leptospirosis. One is mild, one is severe. The severe one is known as Weil disease. Lab diagnosis mein important test here is dark ground microscopy. You can do serology. You can do PCR. The standard. Okay. Treatment mein, if it is mild, doxycycline. If it is severe, penicillin. Prevention mein no vaccine available. In just 1 minute, you can learn one organism. So there are 160 organisms can be revised in just 160 minutes with the help of master charts. People, don't take it lightly. The complete microbiology can be revised in 2-3 hours. Yes, I'm not joking. It can be done. Okay, chalo. Coming on the last bacteria. After that, we will start viruses. Coming on the last bacteria. What is the last bacteria over here? What is the last bacteria over here? The last bacteria is Borrelia. Borrelia. Okay, it is also a spirochete. Let me finish this last bacteria. It is also a type of spirochete. There are 3 types of spirochete I told you. Trypanoma, Borrelia, Leptospira. Trypanoma I will teach you in genital tract infection. Okay, Leptospira I already taught you. Now I am teaching you Borrelia. Borrelia. There are 3 types of Borrelia. Borrelia recurrentis, Borrelia brudolferi, and Borrelia vincenti. The 3 types of Borrelia. Learn the species. All 3 cause 3 different diseases. I will teach you all 3 diseases here. So the 3 types of Borrelia, first of all, you learn. Borrelia recurrentis, Borrelia brudolferi, and Borrelia vincenti. Okay, you can see. They are thread-like. Okay, again the same. It is coming here. Miscellaneous. So it is poorly gram-stained. What about this thing? Again, Borrelia is also spirochete. No? So it is non-capsulated, non-spore forming, but motility is there. Motility is there. It is one of the spirochete, like Leptospira only. and it is corkscrew motility. So motility is same, you can see. So it is non-capsulated, non-spore forming, but motility is present with the help of polar flagella and it is having corkscrew motility. Corkscrew motility, that is the morphology. Culture mein, the culture is BSK. Again the three scientists. Okay, B for Barron, S for Steiner and K for Kelly. Don't learn it. Learn BSK. You can identify in the options, or if you write in your university exam also, you will get the marks. So BSK, and it is microaerophilic. Tell me the mnemonic of microaerophilic. Who was present yesterday? Fast. Tell me the mnemonic of 4 bacteria which are microaerophilic. I told you the mnemonic. The mnemonic is hell. The camp is boring. Okay, boring is Borrelia. Hell is Helicobacter. Camp is Campylobacter. So Helicobacter, Campylobacter and Borrelia. The 3 bacteria which are microaerophilic, they require 5% oxygen. Yad aaya? Have you remembered? So it is one of the microaerophilic. If you have attended yesterday's session, you don't have to need to learn here. So culture, biochemical reaction, nothing important. Antigenic structure, one important antigen present on the surface is outer surface protein, OSP, outer surface protein. Sometime MCQ can be asked. Mode of transmission. So 3 type of Borrelia is there, na? The first type of Borrelia, Borrelia recurrentis, cause epidemic recurrent fever. The second type of Borrelia, Borrelia Brucella, causes endemic recurrent fever. RF is recurrent fever. And the third, Borrelia vincenti, causes Lyme's disease. Okay, how they are transmitted in human body? They are transmitted in human body with the bite of some vector. So you can see, for epidemic recurrent fever, it is via bite of louse. You can appreciate this one as louse. See the images also. It is bite of louse. Endemic recurrent fever is bite of soft tick. This is soft tick people. And Lyme's disease is due to bite of hard tick. Appreciate the hard tick. So please learn the 3 vectors. Please learn the 3 vectors. Louse, soft tick, hard tick. If you don't change the sequence. Okay. So this is epidemic recurrent fever, endemic recurrent fever, and Lyme's disease. Okay. If you don't change the sequence, this is louse. Say louse, then soft tick, then hard tick. In Rickettsia also we have learned the sequence. Louse, flea, tick, tick, mite. Yad aaya? Here also you learn the sequence. Louse, soft tick, hard tick. Louse, tick, tick. Louse, soft tick, hard tick, if you don't change the sequence. So you have to learn in this sequence. Got it? Now clinical features. As I told you, Borrelia recurrentis causes epidemic recurrent fever. Borrelia Brucella, other Borrelia apart from recurrentis causes endemic fever. And Borrelia Brucella causes Lyme's disease. Vincenti is not coming here. Vincenti I will teach you in some other system. Borrelia Vincenti. So Borrelia Brucella causes Lyme's disease. Okay, in all of them, the most important feature is again fever. Why it is known as recurrent fever? Patient is having fever recurrently. Patient have the fever, instantly it goes down. Again have the fever, instantly it goes down. It is not undulating. Undulating was fever was coming. For many days it was not there. Then again coming, then many days it was not there. It is coming daily, but without treatment it goes on. So this is recurrent. This is undulating. That was step ladder. So till now I taught you 3 fever. People, I taught you 3 type of fever. What are the 3 type of fever I taught you? The first I taught you step ladder. Second I taught you undulating. And now I am telling you recurrent fever. So tell me the organism which are causing these fever. Step ladder fever caused by Salmonella. Typhoidal Salmonella. Undulating fever caused by Brucella. Brucellosis के triad में था. Undulating fever, Malta fever, Mediterranean fever along with arthritis and hepatosplenomegaly. And recurrent fever is caused by Borrelia recurrentis. Okay, you can see it is epidemic recurrent fever or endemic recurrent fever. In both of them, the fever is recurrent along with bleeding and CNS involvement. Okay, so that is the disease. Along with the Lyme disease is also there, in which 3 stages are there. First, patient have rash, then skin is involved, and then joints are involved. So 3 stages. I will teach you again Lyme disease in other systems also it will come. So that is the thing. Lab diagnosis में microscopy में again we use bright or Jansa stain. We don't use gram stain because it is poorly gram stain. Culture, serology, PCR में specific gene. I mean nothing important. Nothing. Can you identify where is the organism over here? Borrelia कहाँ है? Where is Borrelia? Can you identify? Thread-like spiral Borrelia in the blood smear. Where it is? You can appreciate it here. The thread-like. Appreciate the threads. Appreciate the small threads. So small thread-like spiral organisms is there. You can be able to identify it. What is drug of choice? If it is mild, give doxy. If it is severe, give ceftriaxone. Mild में doxy, severe में ceftriaxone. Prevention, no vaccine available. We are done with bacteria. People, I am teaching you severe infection. You have not forgotten that, I hope. Okay, I taught you 5 bacteria out of the 21 organisms. 5 are done. Done and dusted. Yes or no? So all 5 bacteria I taught you under a similar headings, under a similar set of headings. So first 2 and next 3. Yes or no? The first 2 are Typhoidal Salmonella and Rickettsia. The next 3, Brucella, Leptospira, Borrelia. I hope you have already filled it. Let me show you the filled version of these. You can appreciate my master charts. Okay, you can appreciate here, I guess, the first 2. You can appreciate the same first 2 under the same headings along with all the images which I have taught you. This is Typhoidal Salmonella and Rickettsia. And you can see the next 3, Brucella, Leptospira and Borrelia. Appreciate the next 3 and appreciate the next 3. Whatever headings I taught you, heading to heading, diagram to diagram, you can match the drug of choice, the prevention, everything you can match, everything. Okay, so please, I'm telling you a way how to make it. If I can make it, definitely you can do. So please take out a notebook, a big notebook like this, make columns and write like this. This is master chart and you will cover the entire microbiology like this. Believe my word. So we are done with bacteria. People, let's come on viruses. Can I start viruses? How many of you are with me? Can we start viruses? How many of you with me? Can we start viruses? Give me a thumbs up. Yes. We will do rapid revision of all 3 subjects one by one. Don't worry. What else? Yes. Any other query you have? You can ask your queries. I'm giving you 30 seconds to ask the query. Meanwhile, I will drink water. Yes? Any relevant query? How to get these master charts? They are available on our website for the sale if you wish, but I recommend you make of your own. Okay, my first recommendation, please make with your own handwriting. Take a snapshot and send it to me on my personal number. I will be very happy to see that. I made these master charts, what you are talking about now, I made these 20 years back. When I was in second prof, when I read microbiology, at that time it was like organism wise only, but I made it for all 160 organisms. From that time only it is fitted in my mind that microbiology is like this only. Now the curriculum is changed from organism wise to system wise. So I changed my master chart from organism wise to system wise. So these are my master charts, but you can make your own also. But if you have less time, like your exams are in the next 20 days, 30 days, you are unable to do so, you can order it. But first preference, you make of your own and send the snapshot to me. Many students make it and they send their pictures to me, and I feel very happy that my strategy is useful for many students. Anyways, chalo, let's start the viruses quickly. Can we start the viruses? Chalo, let's start the viruses. So the 5 viruses I will teach you. The viruses of CVS. The most important among them is 1, HIV. The second most important is Dengue. And after that, Chikungunya, KFD and Ebola. They are small. So I will teach you the 5 viruses. First, learn their names. What are the 5 names? HIV, Dengue, Chikungunya, KFD and Ebola. Learn the 5 viruses. So you can see we have completed the 5 bacteria. And now we are moving towards 5 viruses. So 10 out of them will be done out of the 21. So let's start the viruses. Before I start these 5 viruses, have a look on the classification. Who was present yesterday? I told you the classification of viruses. I told you DNA viruses 6 families, HHA-PPP. I told you RNA viruses 14 families, ABCD-FOR-TP. You were present? Okay, so total there are 38 viruses in our syllabus. I will teach you all in the next 5 days. Don't worry. Today I will not teach you all. Out of the 38, I will teach you only 5. The red one. The red one. The red 5. Okay, so where is my red viruses? These 5 viruses. I am interested in these 5. So can you mark them here? Out of all 38, where is my 5 viruses of today? So you can see my 5 viruses are coming over here. I will teach you HIV. I will teach you Dengue, Ebola, KFD and Chikungunya. Appreciate their families. Appreciate they all are RNA. None of them is DNA. Okay, so first thing, whenever you study any organism now, before you start that organism, you should know that organism is coming where in the classification. Is it a DNA virus, RNA virus? Is it single-stranded, double-stranded? Is it enveloped, unenveloped? What is the symmetry? You should answer all these. Then only I can proceed. Yes or no? So you can see this is the classification and these are the 5 viruses which we are going to study, and you can see they all are RNA. None of them is DNA. They all are RNA. Okay, you can recognize this also. Okay, these are the 6 DNA viruses, HHA. 3 of them are enveloped, 3 of them are non-enveloped. And you can see the RNA. In the RNA, 11 of them are enveloped and 3 of them are naked. Yesterday I taught you that naked is always 3. If you have attended my yesterday's session, if you have not attended, do watch the recording later on. Okay, you can see all the 5 viruses I am going to teach you today. They all are RNA, number 1, and they all are enveloped. They all are enveloped. Their families are coming in the enveloped. None of them is naked. They all are RNA and they all are enveloped. I will not tell this thing again and again in the morphology. Once for all, it's done. Okay, so you can see the same. Now see this classification. Everyone have a look. Dekho. Can you see this classification? Total 38 viruses. Can you see? It's not color coded. This is the same classification. It's color coded. I have given 8 colors for 8 systems. Search the red. Today's system is red system. Okay. Tomorrow we will take orange. I mean respiratory. Yes or no? So today's system is red system. And I want all of you to appreciate it. Appreciate this. Search the 5 red. Search the 5 red. Mark the 5 red. Can you see the same here? So search the red. So here are our red. You can see this one, this one, this one, this one, this one. I can quickly search it. Okay, these are my 5 red viruses I'm going to teach you. So let's start it. We have done bacteria. Let's start the virus. So let's start with HIV. Can I start the HIV, the biggest virus, under a fixed set of heading? Now see the heading of virus. That was the heading of bacteria. This is the headings of virus. Let's start with introduction. HIV. How does human acquire HIV? HIV is acquired from chimpanzees. Human, first time, acquire HIV from chimpanzees by cross-species infection. By cross-species infection from a simian HIV virus in Africa. First time it was in Africa. That is historical importance. Okay. Now coming on the introduction, it belongs to retroviridae. First of all, you should know the 6 plus 14, 6 plus 14, 6 plus 14, total 20 families at the tip of your tongue. Yesterday I taught you. Now tell me, where is HIV? Where is HIV? You can see HIV here. It's belonging to retroviridae. Retroviridae. You should know the family of all viruses. So same thing is written over here. It belongs to retroviridae. Where is the first case we found? First case in 1981. Before you, me, I guess we all are born. I'm also born after 1981, by the way. Okay, so before we all are born, in New York, the first case was there. Okay, discovery of HIV in Pasteur Institute, Paris in 1983. Pasteur Institute of Paris. And World AIDS Day is the recognized or celebrated every year. World Awareness Day for the AIDS on 1st December. This is all introduction, historical part, important one-liners, MCQs you can say. So introduction is done. Introduction will learn 1st December, learn 1981, learn 1983. First case 1981 and discovery in 1983. It was in Africa. It was from chimpanzee and World's AIDS Day is 1st December. Okay, so that is the introduction. After introduction, come on the morphology. My morphology is fixed. What was the morphology of a bacteria? 4 things. Gram status, capsule, spore, motility. What is the morphology of virus? It is fixed. You have to say 3 things. Nucleic acid. Is it DNA or RNA? Is it single-stranded or double-stranded? Number 2, envelope. Present or absent. Number 3, symmetry. What is the symmetry? तुम्हें 3 चीजें बोलनी है. What I mean, whenever we talk about bacteria and whenever we talk about virus. Okay. So if we are talking about morphology. Okay. If we are talking about morphology. So in bacteria, you have to say gram status, capsule, spore, motility. Gram status में gram positive होगा है, gram negative होगा है, gram positive पिछला है, gram negative पिछला है, capsule present absent, spore present absent, motility present absent with the help of mnemonics. Whenever we talk about morphology in a virus, we have to state 3 things. Always state 3 things. Nucleic acid. Is it DNA, RNA? Is it single-stranded, double-stranded? Be very specific. Number 1. Number 2, you have to say after nucleic acid, envelope, present or absent. And number 3, symmetry. You have 3 options in the symmetry. Yesterday I explained you. Is it icosahedral? Is it helical? Or is it complex? Okay, most of them are icosahedral. I told you which one are helical. So you have to learn this. Okay, so this is a standard format. If you make a standard format, things become super simple for you. You will change your perception at looking microbiology. Microbiology can be so easy. Yes, it can be. Okay, chalo. So nucleic acid, you tell me, is it DNA or RNA? Of course, it's RNA. All RNA viruses are single-stranded except Rio. Okay, ये Rio तो है नहीं. So it is single-stranded RNA. It is having 2 copies of RNA. Envelope, yes, it is envelope. You can see. All of them are enveloped. All 5 I will teach you, they are enveloped. This one is enveloped. And symmetry is icosidral. Okay, that is the morphology. Now it is having 2 glycoproteins. Can you see this diagram? It is having 2 glycoproteins on it. Please understand. The first glycoprotein is glycoprotein 120. It is mushroom shape. And second glycoprotein is glycoprotein 41. Glycoprotein 120, glycoprotein 41. These all are glycoprotein 120. Appreciate 120. And these all are glycoprotein 41. 41, 41, 41, 41, 41. These all are glycoprotein 41. So glycoprotein 140 is there, 120 is there, and 41 is there. I will tell you their relevance in the life cycle. Wait. First learn it. So there are 2 glycoprotein 120 and 41. I will tell you the importance of both of them in the life cycle. Just hold on. Okay. There are 3 enzymes inside this virus. What are the 3 enzymes? I will tell you the relevance of all 3. The most important enzyme is reverse transcriptase. It is having reverse transcriptase inside it. Okay. It is having protease inside it. And it is having integrase inside it. Now when I tell you the life cycle, the next. Okay. I will tell you the relevance of this, relevance of this, relevance of this, relevance of this, relevance of this. Learn 2 glycoprotein, learn 3 enzyme, and learn 9 genes. There are total 9 genes. How many genes are present? In HIV, there are total 9 genes. 3 structural, 6 non-structural. 3 structural, 6 non-structural. Total 9 genes. What are the 3 structural genes? GAG, pol, INV. I guess everyone know. GAG, pol, INV. They make the structure. And what are the 6 non-structural genes? 3 of them are essential and 3 are accessory. The essential is TAT, NIV, and RIV. And the accessory is VIP, VPR, and VPU. VIP, VPR, and VPU. You have to identify them in the MCQs only. Okay. Sometimes they are asked to write also in the university exam. Okay. So what we have learned in the morphology, people? What we have learned in the morphology? Tell me the morphology of HIV. HIV ka morpho. Who will tell me? First of all, tell me nucleic acid. Nucleic acid is RNA. RNA, it's single-stranded RNA. Okay. After that, tell me envelope. Envelope is present. Yes, it's enveloped. After that, symmetry. Symmetry is icosidral. Now tell me the unique features. The unique features, it is having 2 glycoprotein, name them. 3 enzymes, name them. And 9 genes, name them. Name them. Try. At least try. Try it. So what are the 2 glycoprotein? I will tell you relevance of each and every one of them in the life cycle. Hold on. First you learn. So glycoprotein. So glycoprotein 120 and glycoprotein 41. ठीक है जी. There are 2 glycoprotein you have to learn. ठीक है. Enzymes. There are 3 enzymes. Reverse transcriptase, integrase, and protease. Learn the 3 enzymes. Okay. And learn the 9 genes. 3 of them are structural and 6 of them are non-structural. The 3 structural genes is GAG, pol, INV. GAG, pol, INV. And the 6 non-structural you learn by yourself. 3 of them are regulatory, 3 of them are accessory. This is morpho. We assume to write in your exam. And we assume you should learn for your MCQs. And you should draw this diagram. Draw this diagram. And you can see all the things are visible here. You should be able to draw the glycoprotein, the 2 copies of single-stranded RNA. Okay, so you should be able to draw that. Okay, ji. Now coming on types of HIV. How many types of HIV is there? There is 2 types of HIV. HIV1, HIV2. The 2 serotypes. I guess everyone know. We divide them into we divide them into groups. HIV1 is divided into 3 groups. MNO, the 3 groups. 2 serotypes, and the first one is having 3 groups. Inside the group M, there are subgroup. Okay, A to K. And in HIV2, it is A to H. You can see the same over here. See the same. See HIV1, see HIV2. HIV1 is divided into M and O. M is further divided from group A to group K. Okay, so this is how you have to learn the classification. This is how you have to learn the classification. What is the mode of transmission of HIV? I guess everyone knows the 4 modes. What is the most important mode of transmission of HIV? Sexual. I guess everyone knows. Most common mode of transmission of HIV. 70% of the HIV is transmitted. I guess 75. I guess 75. Yes. 75% of the HIV is transmitted via sexual route. Most common. The second most common route is percutaneous. Percutaneous is needle prick or same instrument or same needle, same scalpel like that. Percutaneous route. This holds for 10%. The third route is vertical. You know what is vertical? Via placenta. Via placenta in a pregnant lady from mother to fetus. That is known as vertical. This also holds for 10%. 10% transmission occurs via this route. The least common route is blood transfusion. Least common. That is only 5%. Count total 100. You have to learn the percentage. I have written, it's important. So sexual route, 75% of HIV is transmitted via sexual route. 10% via percutaneous and vertical, and only 5% via blood transfusion. You will say, ma'am, why only 5% via blood transfusion? Why it is the least common? Why this one is least common? Because in India, blood transfusion is not direct from donor to recipient. No, it can't be. So there is a blood bank in India. So donor donate the blood to the blood bank. Blood bank will screen it. If it is positive, it's discarded. It's not given to the recipient. If it is negative, then it is given to the recipient. That's why this is the least common route. Now, only thing, if the blood bank is doing some mistake, then it's possible. Okay, even if it is positive and it is handed over to the recipient, it's possible. Or illegally, some donor is giving the blood to the recipient directly without screening, then it's possible. Okay, that's why it is the least common route. Say yes. So what are the 4 routes, people? Sexual, percutaneous, vertical, and blood transfusion. See their percentage of transmission. So sexual is most common, blood transfusion is least common. I guess everyone got it. Everyone got it. Now people, these are the 4 routes. I guess everyone got it. Say the percentage once again. I want to tell you something else. So sexual route is most common, 75%. Okay, percutaneous and vertical is 10%. And blood transfusion is only 5%. But tell me the risk of transmission. Tell me the risk of transmission in all of them. Risk of transmission. I agree. I strongly agree that sexual route is most common. Okay, but with one sexual intercourse, I mean one ejaculation, one penetration, the chances of HIV is only 0.1 to 1%. Now imagine one of the partner, male or female, is HIV positive and the other is healthy, other is not HIV, and they have done the sexual intercourse. So what are the chances the healthy one will acquire the infection from the infected one? So the chances per ejaculation is 0.1 to 1%. See, it's the most common route but least risk of transmission. So after sexual intercourse with the HIV person, the chances of having HIV to a healthy person per ejaculation is 0.1 to 1. And with multiple sexual intercourse, it will keep on increasing. But with one ejaculation, it's 0.1 to 1%. I guess you got it. Okay. Here, the chances in percutaneous is 0.5 to 1%. In vertical, it's 13 to 40. But imagine the blood. Imagine someone is having blood which is positive. I agree the chances are very less. But this blood is already positive for HIV. It is already transmitted either by mistake of blood bank or illegally donor is giving to the recipient. But the blood which is HIV positive, it's already inside the blood of the healthy human. Now there are 95% chance that this person will have HIV. Okay, and here only 1% chance this person will have HIV. So the most common route have least chances of transmission, and the least common route have most chances of transmission. They are reverse. I'm highlighting it. I hope I'm able to explain you. People say yes, say no, but react. Say something. Got it? Got it? So I mean the route which is most common, it is having least risk of transmission. That is sexual route. See the percentage. And the route which is least common, that is blood transfusion, it is having maximum chances of transmission. So mind your MCQ in your exam what they are asking. They are asking most common and least common route, or they are asking the percentage of transmission, risk of transmission. Answers are reverse. I hope you got it. Okay, so that is the mode of transmission. Now, most important, life cycle of HIV. I will tell you in the form of diagrams. Okay, the complete life cycle, the complete pathogenesis of HIV. Okay, now imagine, what is the host cell of HIV? HIV enters in human body. After entering in human body, it attacks CD4 lymphocyte. CD4 lymphocyte of human, I guess everyone knows, or macrophages. So the host cell of HIV is CD4 lymphocyte or macrophage. It is CD4 lymphocyte or macrophage. So see, CD4 lymphocyte or macrophage, this cell is host cell. And this is HIV virus. Appreciate, this is HIV. I guess you can see this is HIV. So HIV is present in the blood of a human. Imagine a human. Imagine a human. In this human, in the blood of this human, this is virus. And this is the CD4 lymphocyte. Now first virus attach with this cell and then fuse with this cell. Two things will happen. First attachment, then fusion, then entry will happen. Before entry, two things will happen. Attachment and fusion. So how attachment takes place? For attachment, people, please understand, it's difficult. For attachment, the main receptors are involved. What do you mean by main receptors? Glycoprotein 120 on the virus bind with CD4 receptor of the host cell. This combination is responsible for attachment. This combination is main receptor and responsible for attachment. So GP120 bind with CD4 of the host. GP120 of the virus bind with CD4 of the host. This is attachment. Okay, this is how virus attach. Now fusion. For fusion, GP41 of the virus, GP41, there are two GP, na? GP41 of the virus bind with either CXCR4 or CCR5. So ma'am, why you are giving two options here? Because I'm not sure which cell is it. If it is a T lymphocyte have CXCR4 on them. And if it is a macrophage have CCR5 on them. These are known as co-receptor. So this GP41 bind with CXCR4 or CCR5, and this one is responsible for fusion. So main receptor responsible for attachment, co-receptor responsible for fusion. Learn the two assembly. The same thing is written in front of you. You can appreciate the same thing is written in front of you. Appreciate GP120 bind with CD4. This is the main receptor responsible for attachment. Okay, and GP41 of the virus bind with CXCR4 or CCR5, depending which cell is it. These are known as co-receptor, and these are responsible for fusion. Now imagine attachment is done. Imagine fusion is done. What's next? Entry. This RNA, single-stranded RNA enters inside. See in my next slide. This single-stranded RNA enters inside. Attachment is done. Fusion is done. Single-stranded RNA enters inside. Now what's the problem? There is a problem. Okay, there is a problem. This single-stranded RNA already enters inside. This is viral RNA, single-stranded RNA. There is a problem. So ma'am, what's the problem? The problem is that this is RNA, but human cell have DNA. This is human cell, na? Human cell. It is having DNA. RNA cannot fuse with DNA. If RNA want to fuse with DNA, it can't. RNA has to be converted into DNA so that it can fuse. Okay, so we have to convert this RNA into DNA. Okay, the virus have done its arrangement by its own. अपना बंदोबस्त खुद करके आया है. The virus has done its arrangement of its own. Virus is carrying the reverse transcriptase enzyme. There are three enzymes, na? I will tell you role of all three. The first enzyme is reverse transcriptase. वो अपने साथ लेके आया है. Virus is carrying its enzyme with its only. Okay, so this reverse transcriptase enzyme convert the single-stranded RNA. This is single-stranded RNA. This enzyme is converting single-stranded RNA into double-stranded DNA. Complementary DNA, double-stranded DNA. So now the RNA is converted into DNA. Okay, now this DNA will move inside the nucleus of the host cell. See, I have given different colors. Red color is host, blue color is virus. Both are DNA now. Okay, now this will enter inside the host cell and integrate with the host cell. Both DNA will integrate with the second enzyme. The second enzyme is integrase. I told you, three enzymes: reverse transcriptase, integrase, and protease. Okay, see the role. So integrase help in integration. See the integration. One red, one blue. Both are integrated. The host DNA, that is human DNA, integrated with the virus DNA. Got it? They are integrated. Now they will do transcription. You know what is transcription? They will do translation. You know what is translation? With the help of transcription and translation, protein is formed. I guess everyone knows. So protein is formed. Okay, multiple proteins are formed. Now the third and the last enzyme. Reverse transcriptase I told you. Integrase I told you. The third enzyme is protease. This is protein which is formed. This protein is broken down into small pieces. Protease break the protein into multiple pieces, and these pieces will form the capsid and nucleic acid of the virus, and multiple daughter virions are formed. So one virus is entering, but multiple daughter virions are formed. Remember, I told you the 7 steps yesterday. Viral replication. If you were attending my session till end, that was my last topic yesterday. So I told you the 7 steps. So the same 7 steps I'm repeating here. Got it? So one virus entered inside the host cell and they replicated and multiple daughter virions are formed. What is the last 7th step? They will rupture the host cell. It is not shown here. Imagine they will rupture the host cell and they all are coming out. They all are coming out, entering the next T lymphocyte. So since the last step is the rupture, so CD4 count falls or macrophage count falls. These are our defense. These are the army of human. The army of the human is falling, and that's why HIV is immunodeficient disease. I hope you got it. Everyone got it? Can we go ahead? Huh? So that was the complete life cycle. Now read it. It is fun for you. Read it. So glycoprotein 120 of the virus binds with CD4 lymphocyte of the host cell. These are main receptors, and they are responsible for entry, or you can say they are responsible for attachment first. Okay, then GP41 of the virus binds with CXCR4 or CCR5 of the host cell, depending what is the host cell. Is it T tropism or M tropism? Okay, and this one is responsible for fusion. Once the fusion and attachment both occurred, single-stranded RNA of the virus come inside the host cell. Now we have to convert the single-stranded RNA into double-stranded DNA. So reverse transcriptase of the virus is doing so. It is converting single-stranded RNA into double-stranded DNA. This viral double-stranded DNA enters inside the host nucleus. After that, it will integrate with the host nucleus. Then transcription takes place, translation takes place, multiple daughter virions are formed. They will rupture the host cell, come out. They will the CD4 count will fall and the person have immunodeficiency. So that was a life cycle which is frequently asked in your exam. If you are preparing for your university exam. For your competitive exam also, many questions are hidden over there. People show some interest. Got it? Huh? Chalo. Coming on the clinical features. There are 5 stages in HIV. It is a typical progressor. There are 5 stages. The first stage is acute HIV disease. Acute HIV disease, the first stage. As soon as HIV virus enters inside any human, it is via any route. It is acute HIV disease. After that, for 3 to 10 years, it's asymptomatic. 3 to 10 years. Okay, there is no fixed duration, but minimum 3, maximum 10. 3 to 10 years, nothing will happen. Okay, after 3 to 10 years, there is persistent generalized lymphadenopathy known as PGL. Persistent generalized lymphadenopathy. Only lymph nodes are enlarged. No other symptoms. After that, symptomatic HIV infection, which is known as AIDS complex, AIDS related complex. And finally, full-blown AIDS with opportunistic infection, because CD4 count is very less over here, maybe less than 200 per microliter. Okay, so these are the 5 stages. First, acute HIV disease, number 1. Number 2, asymptomatic. Number 3, progressive generalized lymphadenopathy, PGL. Number 4, symptomatic HIV infection. And number 5, full-blown AIDS. You have to learn the 5 stages in a sequence. That is the clinical feature. You can appreciate the last one. When full-blown AIDS is there, these are the opportunistic infection. Now you get MCQs on that. Let me tell you this graph. You get MCQs on that. You can see this is the CD4 count. This is the CD4 count on this axis. Normal CD4 count in a healthy human, it's more than 800 per mm cube. It's more than 800 per mm cube. In HIV, it's keep on falling. As the disease progress, okay, the virus is rupturing the CD4. What was the last step? See the last step. The virus is rupturing this cell. This is a CD4 cell. The virus is rupturing it. So CD4 count is falling. So CD4 count start falling from 800. It's falling. At one time, it will become 0. No CD4. Okay. So when the count becomes 500, from 800, it will become 500. Person have bacterial skin infection, viral infection, HSV, herpes infection, and fungal infection. Okay, when the count becomes 400, person have Kaposi sarcoma. These counts you have to learn. When the count is 300, person have hairy leukemia and tuberculosis. At 300, TB occurs. At 200, person have pneumocystis carini pneumonia, PCP, and cryptococcus and toxoplasma. When the count becomes 50, person have MAC, lymphoma, and CMV, and count can become 0 also. You have to learn at how much count which disease occur. This is for your MCQs also, for your universities also. You get many questions over there. People, take it seriously. So please, this is a opportunistic infection. Now, who are the high risk group? Who can have HIV? Who are the high risk group? Who are high risk group, extremely high risk group? Who are moderately high risk group? You have to learn it because there was an INI-CET question this year only. Who is extremely high? Who is moderately high? Extremely high, 4 people. Which 4 people? Female sex worker, prostitute, homosexual males. You can see female sex worker, you can see homosexual males. Okay, female sex worker, homosexual males, transgenders. You can see transgenders. Female sex worker, homosexual males, transgenders, and IV drug users. IV drug users. If you are using the same needle, okay, from some other person which is having the HIV. So IV drug users. So these are extremely high risk group. Learn them. Female sex worker, homosexual males, transgenders, and IV drug users. Who are moderately, not extremely, moderately high risk groups. All doctors. All doctors. Because suppose I am operating some patient, I am doing some procedure on some patient, I am giving simple injection to some patient, and by mistake with the same needle, I got the prick. The same instrument, the same scalpel, I got a cut. So that can happen with anyone, even if we are precautious. So health workers, all the healthcare workers, okay, they are at moderately high risk group. Okay, number 1. Number 2, hemophilics, because they have frequent blood transfusion. Hemophilia. Okay, hemophilia, sometimes it is severe hemophilia, very frequent blood transfusion is required. And the people which is having other STDs. Some other STDs there, so people can have HIV also. So these are moderately high risk group. Now coming on the lab diagnosis. Lab diagnosis, treatment, prevention. That's it. So lab diagnosis. Now please, labeling anyone HIV have many issues. Okay, I'm a microbiologist. Any sample coming in my laboratory and I cannot label it HIV so casually. Come on, the person will be tagged forever. There are many moral, ethical, legal and psychological issues with tagging a person with HIV. You cannot give the report so casually. You have to double check, you have to triple check, you have to full sure that the person is actually having the HIV. You cannot just release the report casually. Okay, why? Because the disease is lifelong. Treatment will be lifelong. Outcome is fatal. Okay, there is no cure of HIV. There is no cure, there is no vaccine available. And in most of the time, the root is sexual. Sometimes it is out of the marriage, some illegal relationship like that. So that can be, the family issues can also be there, psychological issues can be there, legal issues can be there. Okay, so we have to be extra precautious and the person is outcasted from the society. So anyone who is labeled as HIV, the person is outcasted from the society because person thinks it's highly transmissible and other person can also have it. So we cannot just casually release the report. So we follow 3C, triple C pro pharma. We follow triple C. What is triple C? First, consent. We take a written consent in the language the patient can understand that we are performing your HIV test. Person can understand what we are performing from the sample. You cannot perform HIV test of any person. So you have to take the written consent in the language the person can understand. Number 2, confidentiality. If I got any report positive, I cannot just discuss it on my tea table, coffee table with my colleagues or with anyone. No, it should be confidential. It should be handed over to the patient only. Okay, it should be confidential. It should not be revealed to anyone apart from the patient. It should be handed over. It should not be dispatched to the home. Number 3, counseling. You cannot dispatch the report without counseling. So first call the patient. Okay, call to the OPD consultation and just counsel the patient and just explain everything and ask the patient the sexual history. You have to test you have to trace the sexual partners also. All the sexual partners, they can also have the HIV. So you have to take the person in confidence. So that is the proforma. Now coming on the main lab diagnosis. In the lab diagnosis, there are 4 types of tests. First, screening test. If they are positive, we apply supplemental test. If they are positive, then we apply confirmatory test. It is triple step. We cannot release in one step. Screening tests are cheap. Okay, they are cost effective. We perform ELISA and rapid test. If one of them or any of them is positive, we apply supplemental test. That is Western blot and LIA, line immune assay, LIA. Okay, I will teach you all these in immunology. Okay, and then confirmatory test. Confirmatory test is antigen testing. Here we are testing antibodies. We are not testing antigen. Via all these, we are testing antibody. Testing antibody is cheaper. Testing antigen is costly. So confirmatory tests are very costly. And we test P24 antigen or viral RNA or PCR. They all are costly. Now specifically CD4 count. CD4 count keep on falling. But it can fall in other diseases also. It is non-specific. The specific test is P24 antigen. You have to learn that. In window period also, the best test to perform is P24 antigen. Okay. Coming on the treatment, of course, the treatment is ART, antiretroviral treatment, antiretroviral therapy, ART. Okay, there are many regimens available. Don't learn all of them. I will teach you all in pharmacology also, but learn the standard first line treatment given to all patients. If not contraindicated, if the patient can tolerate it. What is the standard first line treatment? Learn that. If you try to learn all, you will forget everything. Learn the standard first line treatment recommended by the WHO. What's that? It's tenofovir. It's recommended by NACO, not WHO. Tenofovir, lamivudine and efavirenz. TLE. Okay, TLE. Please learn. One of them is NNRTI. Okay, and 2 of them is NNRTI and 1 of them is NRTI. I guess you understand what is NNRTI and NRTI. In pharmacology, I teach you this. So please learn. It is tenofovir, lamivudine and efavirenz. TLE. The mnemonic you can learn. TLE. Okay, tenofovir, say it. Tenofovir, lamivudine and efavirenz. This is the standard first line treatment, TLE treatment recommended by NACO to give all the patients unless contraindicated, unless patient cannot tolerate it. If it is contraindicated or patient cannot tolerate, we can give the alternatives. But the first line treatment, TLE, please learn it. Don't try to learn the alternative. Have a look on that. Okay, prevention. When we have to take the prevention is post-exposure. Suppose I'm doing procedure on a patient, I'm giving injection on a patient and by mistake I got the needle prick. And I checked the file of the patient. Oh my God, that was a mystery. The patient is HIV positive and I got afraid what will happen now. I know one of the route of HIV transmission is needle prick. percutaneous, and I'm already exposed. I got the needle prick of a HIV positive person. That can happen with anyone, any of the healthcare provider. So don't panic. In such situation, don't panic. So post-exposure prophylaxis is required in such situation. So in such situation, we will follow the guidelines, but we will give tenofovir again. Okay, emtricitabine. The first is tenofovir. The second is emtricitabine. Both are NNRI. Okay, and third is lopinavir ritonavir combination. Okay, it is known as boosted PI, protease inhibitor. Boosted. If you have learned pharmacology, you may be understanding what is boosted PI. What is boosted? So we are adding ritonavir just to increase the efficacy of lopinavir. So that is boosted PI. Both are PI, but this is not having a role. We are giving it in sub-efficacious level just to increasing its efficacy. So it is known as LR, lopinavir ritonavir combination. This is first line treatment for prevention. So you can learn TELR combination. Here it was TLE, but this E is different. This E is different. This E was equivalence. Okay, and this E is emtricitabine. So please learn it. You have to learn. And tenofovir is in both of them. Here also we have tenofovir. Here also we have tenofovir. The first drug is same, but the second drug here is lamivudine, and third drug is efavirenz. Here the second drug is emtricitabine, and third is PI, lopinavir and ritonavir. That is boosted PI, you can say, and it has to be taken for 28 days. It should be started within 72 hours of the exposure. Suppose I got a needle prick and the person is HIV positive from which I got the needle prick. Oh my God! Within 72 hours, I should start this treatment. And I should take it for the next 28 days. This is known as post-exposure prophylaxis. People, we are done with HIV. How many of you got it? Give me a thumbs up. Everyone. If the patient don't have HIV, you have to check the source, but take the first dose before that. So because as soon as you take the first dose, okay, it is more effective within 72 hours. So don't wait for the result to come out. If the patient status is known HIV, start it straight away. If the patient status is not known, if it is not known, okay, I don't know whether it is HIV positive or negative, take the first dose. Don't take the risk. Then give the blood of the patient for testing. If the patient is available, suppose the patient is gone, then what you will go? You cannot call the patient again. Maybe you don't have the address or patient is not cooperating. And if the patient is known that it is HIV negative, in that case, you don't have to take the post-exposure prophylaxis. Got it? Someone was asking. Got it? Can we go ahead? Everyone give me a thumbs up. Everyone. Can we start the next virus? Yes. Let's start the next virus. The next virus is dengue virus. We are done with HIV virus and now we are starting with dengue virus, the second virus. I will teach you 5 viruses. This is my second virus. Let's start dengue. Okay, dengue virus belong to flaviviridis. No need to learn. I guess everyone know where is dengue. Here is dengue. What is the family? Flavi. This I told you yesterday, classification. Learn the classification. If you learn the classification, you don't have to learn individually. Otherwise, every virus you have to learn the family. Don't do so. Learn all at once. All viruses, 6 plus 14, their families, their members. So see, dengue is coming in flaviviridae. I guess everyone know. Why dengue is known as dengue? Dengue is arrived from a Swahili word dhinga. Dhinga. Dhinga means abnormal gait. Abnormal gait. Dhinga means abnormal gait. Because in dengue, patient have bone pain, severe bone pain, back pain, joint pain, and patient have some abnormal gait. And that is the meaning of dhinga. From the dhinga, the dengue is arrived. That is the historical part if you want to know. So that is the introduction. Come on the morphology. My standard morphology. What is my standard morphology? Nucleic acid. Is it DNA or RNA? Of course it's RNA. Single stranded or double stranded, all RNA are single stranded except Rio. So ये Rio तो है नहीं. So it is single stranded RNA. Envelope, it's envelope. You can see. You can see here. They all are enveloped. Okay. And symmetry is icosahedral. What are the main glycoproteins here? What were the glycoproteins there in HIV? In HIV we have GP120 and GP41. Here we have CME. These 3 glycoproteins. E and M. E and M. These are the glycoproteins which are not very important. They are GP120 and GP41. Here we have E and M. Okay, what are the structural proteins here? There are 3 structural proteins and 7 non-structural proteins. The 3 structural proteins is CME. The 7 non-structural proteins is NS1 to NS5. Not 7. People, I'm sorry. NS, so total 7. It is NS2A, 2B. Okay, and 3A, 3B. So total 7 are there. NS1 to NS5. Among them, NS1 is most important. What is the full form of NS? Non-structural. So you have to learn the morphology, the glycoprotein, the genes, the protein, like that. There I told you 3 enzymes. I told you 9 genes. I told you 2 glycoprotein. Here I am telling you 2 glycoprotein and 3 structural gene and 6 non-structural gene. Okay, you have to learn that. Now coming on the types. What were the types in HIV? Two types, HIV 1, 2. Dengue have 4 types, 1, 2, 3, 4. Den 1, Den 2, Den 3, Den 4. These are the 4 serotypes of dengue. Okay, 4 serotypes of dengue. What is the mode of transmission? Mode of transmission in HIV, I told you 4 routes: sexual, percutaneous, vertical, and blood transmission. You know the most common, least common, you know everything. What is the mode of transmission in dengue? Mode of transmission in dengue is mosquito bite. It's mosquito bite. Which mosquito? Is it Anopheles? No. Is it Culex? No. It's Aedes? Yes. So you have to tell me the species. Aedes aegypti, most common. Say, kaun sa Aedes? Aedes aegypti, followed by, if it is not there in the option, go with the second one. Followed by Aedes albopictus. Learn them in a sequence. Aedes aegypti or Aedes albopictus, both are AA. Aedes, first you learn Aedes. It's not Anopheles, it's not Culex, it's Aedes. लेकिन Aedes में कौन सा Aedes? Aedes aegypti followed by Aedes albopictus. So this is the diagram. I guess you can identify the mosquito. Which one is Anopheles, which one is Aedes, which one is Culex, based on their angle of sitting, based on their wings. I guess you can identify. You have read this, yes or no? Huh? And Aedes do daytime bite. This do the daytime bite. So that is a mode of transmission. Okay. Now coming on the pathogenesis. When the dengue enters the human body with mosquito. Suppose I am a subject, there is a Aedes mosquito who is infected and the saliva is contaminated, the dengue virus is coming and biting me and it enters in my body. It enters in my body. Okay, the dengue virus enters in my body and with any one serotype, suppose dengue 1 or 2 or 3 or 4, anyone, it will cause mild infection. Okay, I will not have something, I will have mild fever, that's it. Okay, but if second time any other serotype, suppose this time first entered, now next time 3, 4 or 2, any other is entering, the second time it's a severe infection, it's the rule. So if dengue occurs 2 times, the second time is very serious. The first time is mild. The first time dengue is mild. Okay, first time one of the serotype is entering, second time other serotype is entering, there are 4 options. First time any of the 4 is entering. The next time apart from that one, any other 3 of them is entering. So second time it's severe. You'll say, ma'am, why it's like that? Why first time it's mild and why second time it's serious? It's severe because 2 types of antibodies are formed. What are the 2 types of antibodies? Neutralizing antibodies and non-neutralizing antibodies. The neutralizing antibodies are protective. So when first time the dengue virus is entering, the body forms the protective antibodies against it and nothing happens. It's a mild fever. That's it. Okay. Now these antibodies remain forever. Okay. Now next time when the second serotype, any other serotype is entering, so these antibodies will give protection for the other serotype also. They are forever. They are giving protection for this time also and they are giving protection for the next time also. But next time the antibodies which are formed for the second serotype, they are non-protective. They are non-antigenic. Rather, they are antibody, they causes antibody dependent enhancement. They are not protective. They neutralize the antibody. I mean, they just decrease the immunity. They just decrease our immunity. They are not protective. They are non-neutralizing. These one are neutralizing. These are non-neutralizing, I'm sorry, these are neutralizing. I mean to say they neutralize the antibody. So our antibody count will fall and they are non-protective. They are neutralizing, they are non-neutralizing and non-protective. Yes, am I right? They are non-neutralizing and they are non-protective. They are neutralizing and they are protective. Okay, so that is the thing. So that's why the first time dengue is mild and second time it's severe. I hope you got it. Clinical feature according to the latest 2009 WHO classification. Before that we have an old classification. We have 2 types of dengue. What are the 2 types of dengue? What are the 2 types of dengue? Probable dengue and severe dengue. Learn the 2 types, probable dengue, severe dengue. What are the criteria of probable dengue? Any patient having nausea, vomiting, rash, bone pain, tourniquet test positive. Okay, any warning sign. Out of these, any warning sign, it's probable. But what is severe dengue? What is severe dengue? If along with all these, if patient is having plasma leakage, like the patient is in shock, patient is having fluid accumulation along with respiratory distress, that is plasma leakage in the body. Plasma leakage, third space loss in the body, or severe bleeding, any sign of the severe bleeding anywhere in the body, or severe organ involvement, like liver is involved, brain is involved, heart is involved. So that is known as severe dengue. So this is probable dengue, learn the criteria, the red one, and this is severe dengue, learn the criteria, the red one. So you get question, what is probable dengue? What are the criteria? What is severe dengue? What are the criteria? This is the latest WHO 2009 classification. That is dengue. What is the lab diagnosis? Most important antigen is non-structural one, NS1. Okay, I told you, NS1 to NS5. Okay, total 7 antigens are there, non-structural. But NS1 is most important. NS1 is positive from day 1 to day 18. You have to learn the day. Okay, last to last NEET PG. It was a question on the days, the 4 options from that. So it is positive from day 1 to day 18. The second, instead of antigen, you detect antibody. You detect antibody. IgM, IgG. IgM is positive from day 5 to day 90. And IgG is positive from day 14 till forever. IgG is always. It is forever. From day 14 onwards and it is still forever. Third, you can do the kit test, rapid diagnostic test, like the pregnancy kit, the kits of the dengue are available. Okay. The virus isolation is positive even before the symptom. Day 1 is the first symptom. Before the symptom, -1 to +5. Please mind this -1. You get MCQs on that. So before 1 day of the symptom, it can be positive. Before the symptom arise, -1 to +5. And RT-PCR also -1 to +5. So please learn the days. Okay, NS1 antigen from day 1 to day 18. The 2 antibody from day 5 to 90, from 14 to forever. And here -1 to +5, -1 to +5. You get MCQs over there and you have to write this in your university exam. The lab diagnosis. Treatment, no specific treatment. We don't have an anti-specific antiviral drug. Like there we have lamivudine, tenofovir. Here we don't have. Here we don't have any. Give symptomatic treatment. Give symptomatic, give platelet transfusion, give blood transfusion, correct the electrolyte imbalance, correct the metabolic imbalance. That's it. Okay, symptomatic treatment. Don't give, we don't have any specific treatment. Prevention, dengue ka vaccine is available. What's the name of that vaccine? Name the vaccine. The vaccine is TDV. Say the full form. C for chimeric. Y for yellow fever. Dengue. So we are mixing 2 vaccines together. One is yellow fever, one is dengue. We are doing the chimeric version of the 2. Chimeric, yellow fever, dengue, tetravalent dengue vaccine. See the full form. Chimeric, yellow fever, dengue, tetravalent dengue vaccine. Total 3 doses has to be taken 6-month interval. First dose after 6 months, second, then third. Okay, subcutaneous. This is the vaccine. You can see subcutaneous dengue vaccine. It is this one. TDV. So this is the name of the vaccine. I hope we are done with dengue also. So 2 big viruses are done. HIV and dengue. You want me to revise? Quickly? But you have to help me. Say, people say. Can you help me? We will try if you help. Chalo. Introduction में. Here I will write 19. जितना मुझे याद आता है, how much I am remembering, I am writing it. Okay. Otherwise, these master charts will help us. Okay. If I am stuck somewhere, I will have a glance at my master chart. See my HIV and see my dengue. See the fixed set of headings. See, this is empty one, this is filled one. This is empty one, this is filled one. It's completely copy. That's why I'm asking you again and again to take out your notebook, make this and fill it with me. It will be this version. It is along with the images. Okay, so if I stuck somewhere, I will see here. Okay, otherwise I will try. Chalo, let's try how much we retain, how much we remember. So here I will write 1981, 1983, chimpanzee. और क्या याद आ रहा है? 1st December is the World AIDS Day. So this much I can remember. If I'm missing something, you can help me. So 1981, we found the first case in New York. 1983, we isolated it in Paris. And 1st December is World AIDS Day. That is the introduction. Here in the introduction, I will say dhinga. The word dhinga, from which dengue is arrived, that is abnormal gait. This is retroviridae. This is flaviviridae. This is my introduction. Let's come on the morphology. In the morphology, this is also RNA. This is also single-stranded. This is envelope present and icosahedral. I just cut, copy, paste. Same here. Single-stranded RNA, envelope present, and it is also envelope present and it is also icosahedral. Here we have 2 glycoproteins. The name of the glycoprotein is GP120 and GP41. Here we have 3 enzymes. Reverse transcriptase, integrase and protease. And here we have 9 genes. 3 of them are structural, 6 of them are non-structural. The 3 structural is gap, pole, in. I guess you know that. Here we have 2 glycoprotein. The name of the glycoprotein is M and E. Not GP1, GP141 and 120. It is M and E. And here we are having 3 structural proteins and 7 non-structural proteins. The non-structural proteins are important. It's NS1 to NS5. NS1 to NS5. I mean NS2A, 2B, 3A, 3B. So total will be 7. But it is NS1 too. Most important is NS1. Okay, so that is the morphology. Let's move ahead. Let's try. Okay, here we have two types. HIV 1 and 2. 1 and 2. 1 is further divided into M and O. And M is further divided from A to K. This one is A to H. I guess I'm right. Here we have 4 types. Dengue 1, Dengue 2, Dengue 3, Dengue 4. I'm not writing, you can write. Chalo. So next, what's next? Mode of transmission. You know the 4 mode of transmission. Sexual, percutaneous, vertical, and BT. You know most common, least common frequency wise, and you know most common and least common percentage of transmission wise. They are reverse. You know that. Chalo. Mode of transmission is bite of mosquito. It is Aedes aegypti, most common, or second most common also you learn it. Okay, so that is the mosquito. Pathogenesis, I told you the life cycle. Here I told you the complete life cycle. First attachment occurs, then fusion occurs, then entry occurs, then the role of the 3 enzymes one by one. You know it completely. The complete flow chart, I told you the diagram. Here when first serotype enters, it's mild. When second serotype enters, it's severe because of the 2 type of antibody, neutralizing, non-neutralizing. That is the concept here. So that is the pathogenesis. Clinical feature. Here the name of the disease is HIV. And it is having 5 stages. You know the 5 stages. First asymptomatic, first acute HIV, then asymptomatic, then PGL. Okay, persistent generalized lymphadenopathy. Then it is the symptomatic HIV, then full-blown HIV, full-blown AIDS. And opportunistic infection at what level, which infection is occurring, that graph you have to draw here. Here we have 2 type of dengue. Probable dengue, you should know its criteria, and severe dengue, you should know its criteria. Okay, I told you the criteria, WHO 2009 classification. Lab diagnosis you can learn. Here lab diagnosis is important, it is having ethical problems. So you follow 3C pro pharma. And you know the lab diagnosis, screening test, confirmatory test, selective test, and non-specific test. Here also lab diagnosis, you have to learn the days. Like NS1 is positive from day 1 to day 5. Day 1 to day 5. Likewise, you have to learn all the days. PCR is from -1 to +5. Okay, likewise, you have to learn all the days. From which day, from antibody, from which day to which day, IgM from which day to which day, IgG from which one to which day. Prevention ke liye, here we don't have any vaccine. Here we have the vaccine. You know the name of the vaccine. This is how you can revise it very quickly, people, in just 1 minute. If you have your master chart ready with you, your own master chart, you just revise one organism in just 1 to 2 minutes. One page don't require more than 4 to 5 minutes. That's my guarantee. Okay, this is how you can retain. You can compare the pathogenesis of both. You can compare the morphology of both. You can compare the treatment of both like that. Okay, sure. We will move. Treatment I skipped, I guess. I have not written treatment heading here. By mistake, I skipped. So here we have specific treatment. You know the specific treatment. TLE. You know the full form of TLE. Okay, and here we don't have any specific treatment. Prevention, here we have the post-exposure prevention. We don't have vaccine, but post-exposure prevention is the TELR. You know what's the full form of TELR. And here we have the specific chimeric yellow fever vaccine. So I hope I'm right. Okay, so let's move on the remaining 3 viruses quickly. Can we come on the remaining 3 viruses quickly? Are you people there? People show some interest. Can we go ahead? I will release the date soon, Firoz. Wait a while. Okay. Got it. Can we go ahead? Chalo. So coming on the next 3 viruses, they're very small. Quickly we will flip them, and in the end, I will fill it completely for you. Chalo. In between, we will not fill. Well, let me finish these 3 together, and together we will fill them. Sure. Let's start. Chikungunya. Okay, what a beautiful name. Chikungunya. Okay. So chikungunya belongs to togaviridae. In introduction, I always tell you family. Okay, whenever it's a virus, in the introduction, you should know its family. Don't learn it. See it here. Where is chikungunya? Search it. Search it, you will find it. Where is chikungunya? I can see chikungunya over here, and it belongs to togaviridae. No need to learn this classification. It belongs to togaviridae. It's also an RNA virus. You can see it's RNA. All RNA viruses are single-stranded only. It's also enveloped. You can see it's enveloped. And symmetry is icosahedral. What's the mode of transmission? Again, there are 3 mode of transmission. Most common, if you want to learn one, mosquito bite. The same mosquito, Aedes aegypti. The same mosquito of dengue. The same mosquito of chikungunya. Aedes aegypti. 99% transmission occurs like that. Rarely it can be due to vertical or blood transmission. You know, vertical, okay, in a pregnant lady via placenta or via blood transmission, but rare. Most commonly, it is Aedes aegypti like dengue. Okay, what are the clinical features of chikungunya? patient have four stages. First of all, patient have acute stage in which patient have fever. Second stage, patient have arthritis. First fever, then arthritis, which is typically migratory. Patient say, I'm having pain over here. After few hours, patient say, I'm having pain here. After few hours, patient say, I'm having pain here. It's migratory arthralgia. That's the highlight. After that, patient have chick sign. Third, brown nose sign. Chick sign, hyperpigmentation of this reason. The nose reason, hyperpigmentation, chick sign. It is known as chick sign. And finally, chronic stage, in which patient have chronic arthritis. So there are four stages. Okay, first acute stage may fever, then patient have acute arthritis, then chick sign, and then chronic arthritis. So these are the four stages of chikungunya. The name of the disease is also chikungunya. The name of the virus is also chikungunya. Lab diagnosis standard, nothing important. You can do virus isolation. Mostly you can do virus isolation on the mosquito cell line. Okay, and you can detect the antibody IgM, IgG. IgM will be positive from day 4 to 3 months, and IgG will be positive from 14 days till forever. IgG is forever. You can do PCR. Oh, not PCR. You can do RT-PCR because it's a RNA virus, na? Common sense. Whenever it's a DNA virus, we will do PCR. PCR is the amplification of DNA. RT-PCR is amplification of RNA. Not actually amplification of RNA. We are converting RNA to DNA first, and then we are amplifying it. So it is RT-PCR because it's a RNA virus. So for all RNA virus, we use RT-PCR. Treatment, no specific treatment, symptomatic supportive treatment, whatever required. No specific treatment we are having. Prevention, no vaccine available. We are done with chikungunya. Can we come on the next? KFD. What is the full form of KFD? First you tell me the full form. You have to tell me the full form of KFD. KFD ka full form is this. It is Kyasanur forest. Kyasanur forest disease. KFD for disease. Okay, because the first time it was observed in this forest. Where is Kyasanur forest on the map in India? It is in Karnataka. It is in Karnataka. So it is in Karnataka, India. In the Karnataka, India, the Shimong district of the Karnataka. In the Karnataka, in the Shimong district, there is a forest. The name of the forest is KF. That is Kyasanur forest. And the first case was identified from there. And that's why it is transmitted from the monkeys of there. And that's why this is Kyasanur forest. You can see it is in Karnataka. It is in Shimong district. And that's why it is known as KFD. That is the introduction. Now tell me the morphology. What is the family? The family is Flaviviridae. Don't learn it. It's like dengue only. Where is KFD? KFD and dengue both belong to Flavi. But chikungunya belong to Toga. Learn the classification. People, classification to learn karna hi padega. We are not giving you any choice. Okay. I'm telling you that you have to learn it. Okay. It's not a choice given to you. Got it? You have to learn this classification. Morphology standard. Nothing important. It's also RNA. It's also single standard. Involute present as usual. Icosahedral as usual. They all have same morphology. What is the mode of transmission? Mode of transmission is bite, but not mosquito bite. The mode of transmission is bite of hard tick. Bite of hard tick. The mode of transmission is bite of hard tick. Which hard tick? It is Hemiphysalis. Hemiphysalis spingera. I mean, it is the scientific name. Sometimes they don't give hard tick in the option. In the option, they give you this fancy scientific name, and you search where is hard tick, and So MCQs come on this. So learn the scientific name of the hard tick. What is the scientific name? At least have a look so that at least in the options you can recognize it. It's okay. Okay. So it is Hemiphysalis spingera. Hemiphysalis spingera. Okay, some fancy name. Identify the image. It's hard tick. Okay. Pathogenesis. Here the host is monkey, rodent and squirrel. Most important host is monkey. I'm teaching you KFD. KFD ka host is monkey. First time it is transmitted from monkey of the KF forest. Kyasanur forest. Monkey se pehli baar aaya hai. So monkey is the main host. Apart from that, squirrel and rodent. Squirrel yani gilhairy. Okay, have you seen the cute squirrels? Squirrels and rodents. These are the host. Okay, but amplifier is only monkey. Okay, inside all this the virus can remain, but inside this it multiply like anything. So all three are host, but monkey along with the host it's an amplifier also. It's the MCQ, people, don't you dare to miss it. So monkey is host as well as amplifier. The other two are only host, not the amplifier. So please learn it, mind it. Disease, what does it causes? KFD. It causes a disease which is having two stages. First stage, second stage. In first stage there is hemorrhagic fever. Patient have hemorrhagic fever. You can see hemorrhagic fever. Patient has severe fever with bleeding, maybe external bleeding or internal bleeding. So hemorrhagic fever. Stage 1. Okay. And stage 2, meningoencephalitis. The brain is involved. Meningoencephalitis. Hemorrhagic fever, number 1, and brain is involved. Okay. That is meningoencephalitis. In chikungunya, there are 4 stages, if you remember. In KFD, there are 2 stages. Please learn the stages. Okay. Lab diagnosis standard. Nothing important. Virus isolation, antibody, molecular. In all the viruses, I'm telling you these 3 things only. Isolate the virus, see the serology, see the antibody, IgM, IgG, and do the PCR or RT-PCR. Here we do RT-PCR, not PCR. Common sense, it's RNA virus. Treatment, no specific treatment, supportive treatment. Prevention ke liye vaccine is available. For chikungunya, we don't have vaccine, but for KFD, we have vaccine. The name of the vaccine is killed KFD vaccine. Okay, it is obtained from chick embryo and is developed in Mumbai, Hopkins Institute of Mumbai. It is developed in Mumbai, Hopkins Institute of Mumbai, and total 2 doses are given, which are 2 months apart. And booster is required every 5 years. This is KFD vaccine. It's available. KFD vaccine. Learn the details little bit. Total 2 doses are required. We are done with KFD. We are done with chikungunya. We are done with KFD. Now the last virus, Ebola. So we are done with bacteria also. We are done with viruses also. So the last virus I'm coming there is Ebola. Can I start Ebola virus? Let's start Ebola virus. So the last virus, Ebola virus. Quickly we will come. Ebola virus. Ebola virus belong to Filoviridae. It's not flavy. People mind it. Ebola belong to Philo. Dengue and KFD belong to flavy. But this one is Philo. See now, see, you yourself see here. So can you see? Where is Dengue? Here is Dengue. Okay, where is KFD? Here is KFD. They are belonging to flavy. Flavy. I told you 2F, na? Here I told you it is 2F. 2F are there. And Ebola is belonging to Philo. So mind, in the option you will get both flavy, Philo. They look similar, but you have to learn that Dengue and KFD belong to Flaviviridae and Ebola belong to Filoviridae. Okay, I'm saying something. You have to insist on that. You have to learn that. So that is the family. We have seen the family. Ebola virus is a global threat now because we got a global explosive outbreak in 2014. In 2014, there was an explosive outbreak. In the Kerala it was. And WHO had declared it a public health emergency of international concern in 2014. Ebola virus, it's a global threat. Okay. So, morphology, standard. It's a RNA virus, single-stranded, envelope is present. The symmetry is helical. And shape is thread-like. See, it's an image-based question. Spotter image, Ebola virus, thread-like. It's thread-like. It's not icosahedral, it's helical. It's not icosahedral, it's helical. So please learn the symmetry and please learn the special shape. Mode of transmission, it is transmitted either via fruit bat. This year FMGE question. It is transmitted either via fruit bat or monkeys. Close contact with fruit bat or close contact with monkeys. Close contact with fruit bat or monkeys. Okay, so please learn the mode of transmission. Pathogenesis में the same, monkeys and fruit bats. Okay, clinical feature. Here 3 stages. Are there. In chikungunya we have 4 stages. In KFD we have 2 stages. In Ebola we have 3 stages. So first stage, initial stage, then progressive stage, then severe stage. In first stage, patient have fever and muscle pain. In second stage, patient have abdomen and diarrhea. GIT is involved. And finally, bleeding and shock. Patient have internal, external bleeding. Patient goes in shock and patient can die. Okay, it can be very dangerous. So these are the 3 stages. Lab diagnosis standard, nothing important. Virus cell lines. You have to learn the cell lines. With specific. For chikungunya, we were using mosquito cell line. Here we are using virus cell line. So cell lines are specific. Treatment, no specific treatment, supportive treatment. But vaccine is under trial. Okay, for chikungunya, we don't have vaccine. For KFD, we have vaccine. For Ebola, it is under trial. Okay, the name of the trial is trial. It is under trials. It is in phase 3. Maybe it is released soon. But it is under trials. You should know. Vaccine is under trials. So we are done. We are done with these 3. You will help me in filling it? If you will help me, then only I will write. Otherwise, I am not going to write. Okay, we are done with viruses, by the way. Yes. Are you going to help me? Okay, so let's try. If we are stuck, our best friend, master charts are with us. I should hang it on my wall here. Okay, and I should have a look all the time over here. So you can see my 3 viruses. You can see this is chikungunya, this is KFD, and this is Ebola. The empty one, the filled one. Okay, let's try. Let's try it. Sure. So tell me the family. So here the family is Toga. Okay, here the family is Flavy. And here the family is Philo, if I'm not wrong. Yes or no? I guess I'm right. Let me check. Yes, I am right. Here in the intro, I will write the KF forest of the Tamil Nadu. KF forest. It is identified in the KF forest. I'm sorry, not Tamil Nadu, Karnataka. KF forest of the Karnataka. And here I must write it's a global threat. It's a global threat, and there was an explosive outbreak in 2014. That is the introduction. After introduction, let me come on the morpho. Okay, they all are RNA. Single-stranded RNA. Single-stranded RNA, single-stranded RNA. They all are single-stranded RNA. They all are enveloped. They all are enveloped. Okay, symmetry, icosahedral, icosahedral, but here it's helical. No specific shape, no specific shape. This one is thread shape. Let me check. I guess I'm right. Okay, tell me mode of transmission quickly. So this one is mosquito bite. Which mosquito bite? Which mosquito? Aedes aegypti. Apart from that, Bt and vertical is also there, but that's rare. So Aedes aegypti. This is bite of hard tick. I assume you know its scientific name also. Hard tick. Bite of mosquito, bite of hard tick. And what is the mode of transmission of Ebola virus? Ebola virus is in close contact with fruit, bat, and monkey. Fruit, bat, and monkeys. Am I right? Yes, I am right. So that is the mode of transmission of all of them. Come on, the pathogenesis. Mode of transmission. It's types. They don't have any types. This is the mode of transmission of all three. Tell me the pathogenesis of all of them. Here, no specific pathogenesis. Here, monkeys are amplifier. Okay, here no specific pathogenesis. Here monkeys are amplified that you have to know. Okay, coming on clinical features. Here we have 4 stages. Here we have 2 stages. Here we have 3 stages. But the common thing, bleeding occurs in all of them. Okay, in the last stage, bleeding occurs in all of them. Okay, in chikungunya, first there is acute first there is fever, then acute arthritis, then chick sign, the brown nose, chick sign, and then chronic arthritis. Okay, here the 2 stages. First hemorrhagic fever and then meningoencephalitis. Here the 3 stage. Initially patient have fever, then patient have GIT involvement, and finally bleeding and shock. Remembering, you have to learn the stages. Treatment, none of them have specific treatment, supportive treatment. Lab diagnosis is standard. Prevention may no vaccine. Here also, here we have vaccine. The killed KFD vaccine, which is discovered in Hopkins Institute of Mumbai, and total 3 doses are given. And here we have vaccine which is under trial. The name of the trial is trial. Here we don't have vaccine. I guess I am right. So you have to broadly write like this, and you have to remember the images. That's it. We are done. So what we are done, people, I'm done with 5 viruses. I am done with 5 viruses. You can see the first 2, you can see the next 3. We are done with viruses. Okay, how many of you with me? Still with me? Can we continue? Yes? Okay. So let's continue. Okay. So let me start first fungal now. Okay. So let me start first fungal. It will be quickly done. In half an hour, I will complete the 5 funguses. Then last 6 parasites will be there. So let me first cover, give me a minute, how I will come on fungus. Let's try. There are 6 parasites and 5 fungus. Till now I covered 10. I'm going to cover the next 5 now. In just half an hour. Funguses are very easy but very scoring. Don't take them lightly. So let's come on the fungal infections first. I will come on parasites also, don't worry. But let's finish this 5 count also. So total 15 will be done. Na? Chalo. So let's start quickly the fungal infections of CVS. Okay, there are 5 funguses: Histo, Blasto, Coccidio, Paracoccidio, and Candidiasis. By the way, these are not fungus. These are the disease caused by the fungus. Histoplasmosis, it's not a fungus. It's the disease caused by the fungus. Okay, I will tell you the causative organism of all of them. So let's start the fungus now. We are done with bacteria. You know the 5 bacteria now. We are done with virus. You know the 5 viruses now. We are coming on fungus. Learn the 5 fungus first. Learn the 5 diseases of the fungus. I will tell you their details under a fixed set of heading. Fungus are very small but very scoring in all exams. Don't take them lightly. So let's start the funguses. You can see my screen, right? Yes. So let's start the funguses. We are done with the bacteria. Done and dusted. We are done with viruses. Done and dusted. Parasites are pending. I will come on that. And now funguses. Quickly in just 20 minutes. I will pack them. Chalo. Let's come on funguses. Quickly. Funguses. You can see the funguses. Before I start the details of these 5 funguses, I'm interested in these 5 funguses. Okay. You should know the complete classification of fungus. You know. So yesterday I didn't told you the complete classification, but I assume most of you may be knowing that we divide the fungus into 5 categories. Total 5 categories. The fungus which cause superficial infection, they are involving the superficial skin, superficial mycosis. The fungus which cause infection just below the superficial skin, that is subcutaneous mycosis. This is superficial mycosis. This is subcutaneous mycosis. Superficial mycosis, subcutaneous mycosis. The fungus which enter via respiratory tract. Suppose I am the subject, I am inhaling. The fungus is going in my lungs. First it causes pneumonia in my lungs. It causes pulmonary symptoms. From there it goes in blood. And from blood it is involving multiple disseminated organs. So that is known as systemic because all the organs are involved. Dissemination. First organ is lung. Okay, and then all organs are involved. So today I will teach you these one. Histo, Blasto, Coccidio, Coccidio, they come in this category. Okay, that is the third category. The fourth category is opportunistic mycosis. What do you mean by opportunity? What is opportunity? English word opportunity. These are the fungus. They cannot enter in a healthy individual. No, they cannot enter in a healthy individual. No, they need an opportunity to enter the human body. And what's that's opportunity? That's opportunity is low immunity. So they enter only in immunodeficient person, and that's why they are known as opportunistic mycosis. So opportunistic mycosis are the fungus that enter in immunocompromised people, like the people who have AIDS, people who have some immunodeficient disorder, people on steroid, on chemotherapy, like that. Okay. And last is mycotoxicosis. Here fungus do not cause the disease. Yes. Here the toxin secreted by the fungus cause the disease. Mycotoxicosis. The toxin secreted by the fungus causing the disease. Okay. So I guess everyone knows this. If you don't know this, people, step number 1. You have to learn all 4 classification. In my class, if you are attending my class anywhere on YouTube, on any platform you are attending, okay, first thing microbiology, learn bacteria, virus, parasite and fungus ka classification. You should know all 158 organisms at the tip of your tongue where they are coming. All bacteria, all virus, all fungus, all parasite at the tip of your tongue. So that if I am teaching you any organism, you should recognize its category. Okay, you cannot learn the stories unless and until you don't know ABCD. So step number 1, we teach the kids ABCD. Okay, then only the kids can understand the script. They can understand the stories. Okay, you directly start reading the stories. You don't know the foundation. You don't know the letters. So that is not the right approach. Now see, in these 5 categories, which funguses are coming? I'm not reading the names. I assume you know that. So please read the names. So in superficial mycosis, there are 4 fungus. Okay, in subcutaneous mycosis, there are 4 fungus. In systemic mycosis, there are 4 fungus. In opportunistic mycosis, there are 6 fungus. Okay, there are 6 fungus. Mycotoxicosis is not important. They are not important. So count them. 4 plus 4 plus 4 plus 6. Total 18 fungus in our syllabus. I will teach you all 18. All 18. We are having 5 more days now. I will teach you all 18. But today, I will teach you 5 of them. I will not teach you all 18 today. Today, I will teach you 5. 5 of them. Where are my 5? Today's 5. The red 5. The 5 which cause infection in CVS. What are my 5 fungus? The fungus which cause these 5. Where are these? So you can highlight. You can see. These are the 5 fungus I am going to teach you today. I will teach you these 4. Histo, Blasto, Coccidio, Coccidio, which are coming in systemic mycosis. And one of the opportunistic mycosis. From the opportunistic mycosis, candidiasis. So total 5, the fungus which cause CVS infection. See my red strip. Which cause blood and CVS infection. They are in front of you. They are in front of you. You see in overall classification where they are coming. So whenever I start any category, but till now you got my pattern. Bacteria, virus or fungus or parasite. First I tell you the overall classification. In that overall classification, I highlight that particular fungus with that color. Okay, I will show you something. Wait, I will show you my red colors. I want to show you. Just a second. Okay, here in PPT I forgot to put. See this lower classification. Lower. It's the same classification in front of your screen. It's the same classification in front of your screen, but it's color coded. Now search the red color. I'm closing it. Search the red color. You will see 5 reds. 4 are here. You can see, and one of them is here. A small strip. Candidiasis causes infection in multiple systems. So I have given multiple colors. I will teach you Candida 4 times because it will come in 4 systems. And these 4 are red. So I am interested in these red. So today's system is red system. Okay, so these are my 5 red fungus I'm going to teach you today. So with this introduction, I would like to start the fungus. Can I start the fungus now? I should start. Okay, shallow. These are the 5 fungus. So name their causative organism. Till now, I taught you the bacteria, I taught you the virus, I told you the name of the organism. But in fungus, I don't tell you the name of the organism. These are not name of fungus. People, these are the name of the diseases caused by fungus. Okay, so these are 5 diseases caused by fungus. Histoplasmosis, Blastomycosis, Paracoccidiomycosis, Coccidioidomycosis, Candidiasis. These are names of disease. Now tell the fungus which is causing this disease. It's very easy. So histoplasmosis is caused by histoplasma. तो सबको पता है. Everyone knows. Even a kid knows. Capsulatum is what you have to learn. So it is caused by histoplasma capsulatum, the first disease. Blastomycosis caused by blastomycetes. वो तो वही है, blastomycetes. But it is dermatitis. You have to learn this dermatitis. Here you have to learn capsulatum. Okay. Paracoccidiomycosis caused by Coccidiomycosis caused by Coccidioides. ये तो everyone knows. But imidis, you have to learn the species का name. You have to learn the species. Genera, you know. Genera is same. But you have to learn the species का name. You are getting my point. Paracoccidiomycosis, Paracoccidioides, Paracoccidiosis. But Brasiliensis is what I am expecting you to learn. Candidiasis is caused by Candida. वो तो ठीक है. But it is Candida albicans. So people learn the species name. Histoplasmosis, Histoplasma capsulatum. Blastomycosis, Blastomycetes, dermatitis. Coccidiomycosis, Coccidioides immitis. Paracoccidiomycosis, Paracoccidioides brasiliensis. And Candidiasis caused by Candida albicans. Give me a thumbs up. At least identify them so that you can identify the options, the 4 options given to you. If you cannot write the correct spelling, it's okay. It's okay. Nobody is going to correct your spellings in the exam. But broadly, if you are writing it correctly and you can identify in your MCQs, that's a good deal. Okay. So that is the 5 fungus. Now, these 5 fungus, out of these 5, these 4 are dimorphic fungus. You know what is dimorphic? Have you heard this word? The basics of mycology. You know, dimorphic fungus. क्या होता है भाई? What is dimorphic fungus? What is double dimorphic fungus? So they behave differently at different temperature. These 4, the first 4, not Candida. Candida is not dimorphic. Okay, Candida is a yeast, permanent yeast. Okay, not yeast, yeast-like. But these 4 are dimorphic. At 25 degree, they behave differently. At 37 degree, they behave differently. What is human body temperature? Human body temperature is 37 degree. Okay, so at 37 degree, they become yeast. But at 25 degree, outside the human body, they are mold. You know what is mold and what is yeast? You know what is mold, what is yeast, yes or no? See this video. This is yeast. I'm sorry. This one is yeast. What is yeast? Yeast is spherical. Yeast is this. It's spherical. See, they all are spherical. And they divide by budding. Appreciate, they are dividing by budding. Appreciate it. So yeast is spherical and divide by budding. It's yeast. Learn the 2 properties of yeast. It's spherical. It divides by budding. What is mold? What do you mean by the term mold? Mold is elongated. You can appreciate it's elongated. It's not spherical. And it divides by branching. The branches are known as hyphae. So this one is spherical. This one is elongated. This one divided by budding. This one divided by branching, that is hyphae. You can see in the images. You can see in the videos I have provided. So these 4 fungus. Which 4 fungus? Histo, Blasto, Coccidio, Paracoccidio. They are dimorphic. So all of them, all these 4, at 25, they are mold. See, they are elongated. Okay. And at 37, they are yeast. See, they are spherical. They all 4 are same. Okay. Before I start the details, I must tell you. And these all are systemic, na? What do you mean by systemic? I told you, na, in the classification. They all are coming in the systemic mycosis. All these, all 4, they are coming in systemic. What do you mean by systemic? They all enter via respiratory route. So once they enter via the respiratory route, the first organ they involve lung. After that they go in blood and then they do the dissemination. Since they involve multiple organ dissemination, that's why they are known as systemic. Now the introduction is over. It's time to start the 5 fungus. Can I start? Introduction is very necessary, people. If you have the foundation now, nothing. We will run like this. Okay, so the 5 funguses are in front of you. I will open my master chart also, hang it in front of me, and we can quickly revise the 5. Can I start the first one? Are you people with me? So let's start. Let's start. The first one, histoplasmosis. Fungal infections of CVS. I'm starting with histoplasmosis. Let's start the first one, histoplasmosis. Introduction, I will tell you its other name. Other name. Learn its other name. Okay. Histoplasmosis is known as darling disease. What a beautiful name. Darling. Okay. Why is it known as darling disease, by the way? Why is it known as darling disease? Because it is discovered by a scientist. The name of the scientist is very funny. It's Sommel Darling. And that's why it is known as darling disease. But it's your PYQ. It's your MCQ. Okay. Histoplasmosis is known as darling disease. Okay. Because it is discovered by Sommel Darling. That is the introduction. Causative organism, I already told you. Histoplasma capsulatum. But there is a catch. What is the catch? Looking at the name, you may feel like it is capsulated. That's why the name is capsulatum. But no, it's a misnomer. It's not capsulated. Okay. Because once upon a time, there was a question in your NEET PG. Okay. Which of the following fungus is capsulated? And one of the option is Histoplasma capsulatum. So students thought कि हाँ capsulatum है तो capsulated होगा ही. Very easy question. No, no, no. There was a trap. Histoplasma capsulatum is not capsulated. It's a misnomer. Please mind it. Write down. It's non-capsulated. Only one fungus is capsulated. I told you the capsulated organism yesterday. You were present yesterday. I told you 9 bacteria and 1 fungus. Total 10 organisms are capsulated. Which was the fungus? Only one fungus capsulated. Who will tell me the name? Cryptococcus. Cryptococcus is the fungus. Okay. Got it? Cryptococcus is the fungus who is capsulated. Only one, not Histoplasma capsulatum. Okay. So that is the introduction. Write down darling disease. Causative organism, Histoplasma capsulatum. It is not capsulated. Clinical feature. First clinical feature is always pulmonary. I told you in all of them, the first clinical feature is always pulmonary. They involve the lung. After that, they disseminate in the body and involve multiple organs. So first is pulmonary. In the lung, they cause flu, they cause pulmonary infiltrates, they cause cavitation, and they involve the hilar lymph nodes. So you can see here, they are causing pneumonia basically. They are causing cavitatory lesion. They are causing pulmonary infiltrates. They are involving hilar lymph nodes. Before that, they cause flu. That is pulmonary. After that, they enter in skin. After that, they enter oral and mucosal cavity. Mucosa. First, they involve lung. Then they involve skin. Then they involve mucosa in the oral cavity. And after that, they disseminate in many organs like bone marrow, spleen, liver, eye, adrenal. Don't learn it. Learn first, learn second, more than sufficient. Histoplasmosis. The name of the disease is histoplasmosis. Clinical features are done. Lab diagnosis is standard. People, all 5 fungus under these lab diagnosis. Learn the 5 lab diagnosis standard for fungus. It is standard. Okay, even you don't know how to write, you have to write the 5 headings. Okay, direct microscopy, culture, serology, skin test, molecular test. One by one I will take. So first is direct microscopy. In direct microscopy, we are taking sample from human body. Yes or no? Of course. Direct microscopically, suppose I am the subject, I am having some fungal disease. Out of these 4, Histo, Blasto, Coccidio, Paracoccidio, you are the doctor. You are taking sample from my body. So what is my body temperature? My body temperature is 37. So if you take the sample in a test tube from my body, okay, so what you will get? Yeast or mold? Yeast or mold? 37 pe kya milega? So at 37 degree, you will get yeast. So direct microscopy, you get a yeast. In direct microscopy, you always get yeast. Okay, because direct microscopy, you are taking the sample from patient body, it's at 37. In patient's body, in patient's blood, they are in the form of the yeast. So here, this is the yeast form of the histoplasma. I will draw it. Okay, yeast form of the histoplasma. The yeast form of the histoplasma is budding yeast. See, I am drawing histo and my next is blasto. I am drawing both. Histo and blasto. Listen, this is also budding yeast. Let me draw the budding yeast here. Okay, yeast is budding. Okay, this is also budding yeast. You tell me the difference. You tell me the difference between the two. This is a budding yeast with narrow base. And this is the budding yeast with broad base. This is budding yeast with narrow base. This is budding yeast with a broad base. Learn B for blasto. Broad for blasto. This is a very important MCQ. Both are budding yeast. This is also budding yeast. This is also budding yeast. But this is narrow. This is broad. Image-based question comes in your exam very frequently. Please learn it, people. Please learn it. 3 differences are there. This is the first difference. This is single layered. This is double layered. Thick walled. Thick walled, double layered. Blasto. Blasto is thick walled, double layered. Number 2. And number 3 and last. This is always intracellular. It resides inside the macrophage of human. It is not free in the blood. In my blood, suppose it is present, so histo is present inside the macrophage. It is not present freely in the blood. This one is free in the blood. Tell me the 3 differences between histo and blasto ka yeast form. Okay, so in human body, histo is also present in yeast form. In human body, blasto is also present in yeast form because human body temperature is 37. So histo and blasto both are present in yeast form. Okay, so you can see this is histo, you can see this is blasto. You can see this is also budding yeast, this is also budding yeast, but this is narrow base, this is broad base, this is single walled, this is double walled, this is always intracellular, this is the macrophage of human. Okay, this is the nucleus of the macrophage. They are intracellular, they are free. So please learn the 3 differences. I hope you are getting it, everyone. So see histo. Currently I am teaching you histo, the direct microscopy of histo. Histoplasmosis. See the yeast form. Now you will realize the diagram, appreciate the diagram. Appreciate this is the macrophage. Say yes. This is the nucleus of macrophage. Say yes. And appreciate the narrow-based budding single-walled. Say again, narrow-based budding single-walled. You can see here. Okay, narrow-based budding, single-walled within the macrophage. This is a real diagram. Okay, in reality, it's like this. You can see this is the macrophage, inside which these are the budding yeast. Okay, budding yeast are there. So that is histoplasmosis. You can do the culture. Culture is the gold standard. Okay, culture we will do on SDA agar. I guess you know, for all fungus we use SDA agar only. Okay, SDA agar is like nutrient agar of bacteriology. Here we use SDA, severodextrose agar. SDA agar standardly. So I will take 2 SDA because these are dimorphic fungus. Na? Suppose this is my patient ka sample. This is my patient ka sample in which I am suspecting it contains histo. I'm not sure. Budding histo. I'm not sure. It may be, it may not be. Okay, I want to sure. So I will take 2 SDA agar and I will do inoculation on both. Okay, one I will keep at 25 degree for 24 hours. One I will keep at 37 degree for 24 hours. After 24 hours, I will examine the colonies here. I will examine the colonies here. You tell me what I will get on the both. This is known as dual inoculation. What is known as dual inoculation? It is done for dimorphic fungus. Dimorphic fungus के लिए करते हैं because of course dimorphic fungus grow differently at 2 temperature. So this one I am inoculating at 25 for 24 to 48 hours. This one I am inoculating at 37 for 24 to 48 hours. I will get colonies on both of them. I will examine the colonies. What I will get at 25 I will get mold. At 37 I will get yeast. So draw the diagram of both. So this is SDA. So what you are going to get at 25, you tell me. What you are going to get at 37, you tell me. So at 25 I will get mold. See, the molds are elongated. Appreciate the elongated. They are not spherical. They are elongated, appreciated. And they have conidia. They have 2 types of conidia. Microconidia, macroconidia. The microconidia is spherical. Appreciate. Spherical. But the macroconidia is tuberculate. Tuberculate, like finger-like projections. Tuberculate. It's like the finger-like projections. The macroconidia. Okay, this is how you have to draw the yeast form of histo. The yeast form of histo and mold form of histo. This is a mold. And the yeast form you already know, budding yeast, narrow-based budding. You can appreciate small, narrow-based budding. You may be thinking, ma'am, why you have not drawn a macrophage? This is on SDA. This is not in human body. In human body, it is present. The same thing is present inside the macrophage. In human body, the same thing is present inside the macrophage. But on SDA agar, these are free. These are not in the SDA agar don't have macrophage. Okay, so these are narrow-based budding. I hope you got it. You got the mold, you got the yeast. So summary. Histoplasma capsulatum. When it is inoculated on SDA agar. So at 25, what I will get? Mold. At 37, what I will get? Yeast. Draw the diagram. Draw the diagram with me. So here I will draw the mold like elongated, like this. I will draw the macroconidia tuberculate and the microconidia spherical, like this. This is mold. And here I will draw the budding yeast with narrow base. Budding yeast with narrow base. I highlight the word narrow. So this is the summary you have to learn. You get many image-based question on that. So culture is done. Okay, you can see this is the mold form. Appreciate the tuberculate macroconidia and appreciate the microconidia. And these are molds. Okay, chalo. The remaining 3 tests are not important. Serology may you test antibody, skin test sometimes you test for hypersensitivity, and molecular may you can do PCR for all the organisms. Okay, PCR for all organisms targeting specific gene. You make a list of specific gene of all the organisms. It will be better to revise at the end. So that is the lab diagnosis. Drug of choice for histoplasmosis is the amphotericin. Drug of choice is amphotericin B, liposomal amphotericin B. I guess you know amphotericin B is very toxic, especially nephrotoxic. So we use the liposomal version of that. So liposomal amphotericin B is the drug of choice. So we are done with histo. C, we are done with the first one. Can I come on the second one? It's very easy. So first one is done. C, its yeast form. C, its mold form. C, its yeast form at 37 degree. C, its mold form at 25 degree. Appreciate it. Coming on the next one, Blasto, under the same heading. Histo is known as darling disease. What is Blasto known as? Blasto known as North American Blastomycosis. What it is known as? Not because it occurs only in North America, nowhere else. Thankfully, don't occur in India. It occurs only in North America. Okay, in the North America, it occurs in Chicago. Chicago is in North America. So it is also known as Chicago disease, North American disease, and it is also known as Gilchrist. Actually, I don't know why it is known as Gilchrist. I don't know the historical aspect of this. So it is known as Gilchrist, you can learn. So North American Blastomycosis, Chicago disease, and Gilchrist disease. So learn the introduction. Okay, causative organism you already know. It is Blastomycetes dermatitis. Dermatitis is what you have to learn, the species name. So causative organism is done. Clinical feature, first symptom is pulmonary. First is pulmonary. Second is skin. Third is bone. Okay, first is pulmonary. Then it goes in blood. After blood, it involves skin. Then it involves bone. Then it involves genitourinary. Then it involves CNS. So you just learn the other organs. Okay, you don't have to go in the detail. First is always pulmonary, most common. Lab diagnosis, this is important. We will compare the direct microscopy and culture. In direct microscopy, you have to tell me only yeast because it is from human body. But in culture, you have to culture on SDA on both temperature, 25, 37. So you have to tell me yeast and mold both. So that is the thing. And these three things are common in all of them. These three things, serology, skin test and molecular are common in all of them. Direct microscopy, you will get yeast. Culture, you will get both. Because you will inoculate the SDA, one at 37 and one at 25. So you will get both. I hope you are getting it. So what you will get in the direct microscopy, I already told you. No? Here also we will get the budding yeast, but broad base. Okay, here also we get budding yeast, double-walled budding yeast, but broad base. In contrast to histo. You can appreciate the budding yeast. Any of the image can come in your exam. Appreciate the budding yeast here. It's the IBQ of NEET PG. Appreciate the double-walled, broad-based budding yeast. Appreciate it here. Okay, here you can see. Appreciate it here. Any image can come. All of them are showing the same finding. I want to ask you something. Use your common sense. I want to ask you something. Histo, Blasto. I'm drawing the diagram. Yeast of both of them. To ask a question. Okay. This one is budding yeast like this. This one is budding yeast like this. Okay. This one is narrow base. This one is broad base. I guess everyone knows that. My question for you. My question. Which among the two is known as figure of 8? Figure of 8. And why? The most important question is why. Write down in the comments. Figure of 8. Figure of 8 appearance. Which one of them? Is it histo or is it blasto? Let me see what you are saying. Say now, people. Say now something. Let me refresh it. Is it histo or blasto? Some is saying histo. Anaya is saying histo. Soham is saying blasto. But why? Why? If I use my common sense, okay, how we write 8? How you write 8? You write 8, the number 8, we write like this. Okay. So you will see, ma'am, it's narrow base. Now. So it should be histo because it is looking like narrow base. But actually we write 8 like this when we are in hurry. This is the wrong way of writing 8. The digital 8 is like this. Have you seen digital 8? It's like this. Digital 8. So it's broad base. And that's why blasto is figure of 8. Appreciate the blasto. Okay. So now you will never forget. So blasto is figure of 8 appearance. It's figure of 8 appearance. Appreciate. The figure of 8 appearance is blasto. It's your question. It's your PYQ. Everyone got it? Okay. Now let's do the culture. We will do the culture on SDA. Okay. Again at 25, at 37. So at 25, we get the mold. See the mold. Here in the mold, we have pear-shaped conidia. We don't have macro and micro. All the conidia are pear shape. Pear shape. All the conidia are pear shape. We don't have macro and micro. Okay. And yeast form. You already know. You can see broad base, budding yeast, broad base. Okay. You can compare histo and blasto. I already taught you. See the histo, see the blasto. Appreciate the narrow base here. And appreciate the broader base here. This one is figure of 8. The blasto is figure of 8. I hope you are getting it. Otherwise, serology, skin test and molecular, nothing important. You just enumerate them. Okay, serology, skin test and molecular. Drug of choice is amphotericin B. Here also drug of choice is amphotericin B. So till now, out of 5, 2 are done. 3 more to go. Got it? Give me a thumbs up. You can appreciate the yeast of both. You can appreciate the mold of both. Appreciate the yeast. Okay. Narrow budding, broad budding. Single wall, double wall. Intracellular, inside a macrophage. Free. Okay. Here 2 conidia. Macro, micro. The macro conidia is tuberculate and microspherical. Here only one type of conidia, pear shape. All of them are pear shape. This is mold, this is mold. Elongated. I hope you got it. This is at 37, This is at 25. I hope you got it. So you get questions on that. Coming on the third one, Coccidiomycosis. Let's start the third one. The third one is Coccidiomycosis. What is the other name of Coccidiomycosis? Coccidiomycosis is known as desert. It occurs in California. It occurs in California only. That's why it is known as California fever. You know, in California there are many deserts and many valleys. In the city California there are many deserts and many valleys. That's why it is known as desert rheumatism and valley fever. So learn all three names: California fever, desert rheumatism, and valley fever. Constitutive organism we already know. Coccidioides immitis. Coccidioides immitis is what you have to learn. Clinical features you already know. Most of the time it's asymptomatic. Most common symptom is pulmonary. Always they all have pulmonary, most common symptom. After that, skin, joints, and dissemination. Learn the sequence. First asymptomatic, then pulmonary, then skin, then joints, and then dissemination. Okay. Lab diagnosis may, here you will get yeast and here you will get both yeast and mold, depending at what temperature you are inoculating. These three tests are same in all of them. Till now you got the pattern. So in direct microscopy you will get a spirule. The yeast is not budding yeast. The yeast is like a spirule. The yeast form of Coccidiomycosis is like a spirule. Appreciate the spirule. Appreciate this is a spirule, and inside the spirule multiple endospores are there. Inside the spirule multiple endospores, small endospores, 200 to 300 endospores are there inside the spirule. You can appreciate this diagram and you can appreciate this diagram. Any of the diagram can come in your exam. Appreciate. It's a spirule containing 200 to 300 endospores inside that. It's the yeast form. It's not a budding yeast. It's a spirule containing the endospores. Culture, we will do the culture on both 25, 37. Let's see. So at 37, it's spirule only. At 37, you already know it's spirule. But what about at 25? Unique mold. It is mold, but unique mold. It is known as fragmented mold. What is known as fragmented hyphae? Fragmented hyphae. Okay. So it is having arthroponidia. One is intact and one is empty. One is intact, one is empty. One is intact, one is empty. One is intact, one is empty. Arthroponidia. And since this alternate arrangement of intact, empty, it is known as fragmented hyphae. Very important PYQ. Learn this image. Fragmented hyphae. I am talking about Coccidiomycosis, fragmented hyphae, arthroponidia are there. One is intact, one is empty or distorted. Okay, so alternate arrangement. It is known as fragmented hyphae. You can imagine image-based question can be asked. Okay, and here it is spirule only. Here it is spirule. And the other, you can appreciate the images. This can come in your exam. This can come in your competitive exam. You can appreciate. One is intact, one is empty. One is intact, one is empty. Appreciate it, na? You can appreciate one intact, one empty. One intact, one empty. One intact, one empty. So these are your PYQs, people. The other three tests are same. Nothing important. Drug of choice here is not amphotericin. Drug of choice is itraconazole. Itraconazole is the drug of choice. Okay. Watch my session on antifungal drugs. Have covered all of them. Okay, chalo. So we are done. We are done with Coccidiomycosis. We are done with three of them. Appreciate the yeast form. Okay. Narrow-based budding, broad-based budding, spirule. Okay. Appreciate their mold form. Mold में two conidia, macro, micro. Macro is tuberculate, micro is spherical. Only one conidia, pear shape. Okay, fragmented hyphae. One intact, one distorted. One intact, one distorted. Appreciate it, people. Appreciate it. Appreciate my comparison. Appreciate my master chart. I will show you my real master chart of this. Okay, coming on the fourth one. The fourth one is Paracoccidiomycosis. What is the other name of Paracoccidiomycosis? What is the other name of Paracoccidiomycosis? The Paracoccidiomycosis is known as South American. Okay, tell me other name. This one is Darling disease. This one is North American, Chicago Blastomycosis. This one is California or desert rheumatism or valley fever. Okay, this one is South American Blastomycosis. This is North American. This is South American. Mind it. This is North American. This is South American. Learn its other name. It is known as South American Blastomycosis. And in some other language, some other name is there. You can read it. Like Lutz, Splendor, D, Almeida disease. I don't know its name. It's some other language. You can have a look for your MCQs. Okay. Constitutive organism, you already know. It's Paracoccidiomycosis brasiliensis. This one is brasiliensis. Learn the species name, brasiliensis. Clinical feature, it is having two forms, acute and chronic. Acute occurs in young people, chronic occurs in old people. This one is less common but more severe. This one is more common but less severe. Here dissemination occurs. Here reactivation of the Custon fission occurs. So two type of Paracoccidioidomycosis. Again, lab diagnosis mein you will get yeast, culture mein you will get yeast and mold at both the temperature at 37 and 25. These three tests are same as usual. So let me tell you the direct microscopy. In direct microscopy, it's budding yeast. It's budding yeast. But two type of budding occur. See, either the budding, this is a yeast. Appreciate this is a yeast. Okay. And two small buds occur. Two small buds occur. Have you seen a Mickey Mouse? You watch cartoons? My kid watch all the day. Huh? So you watch cartoons. You know the character Mickey Mouse in the cartoons. You may be knowing it's a famous character. So it is looking like the ears of a Mickey Mouse. It's looking like the ears of a Mickey Mouse. Let me draw like a good Mickey Mouse for you. It is known as Mickey Mouse appearance. What it is known as? Mickey Mouse appearance. Mickey Mouse appearance. Okay. And sometimes instead of two, it is having multiple small buds. Multiple small buds. It is looking like pilot wheel or champion wheel. Pilot or champion wheel. So now the two appearance. Mickey Mouse and pilot wheel. If it is having only two buds, it is Mickey Mouse, like the ears of a Mickey Mouse. And if it is having multiple buds, it is known as pilot wheel or champion wheel appearance. Now coming on the culture. Culture may at 37 it is same. It is Mickey Mouse appearance and pilot wheel appearance. It is yeast form. But you have to learn at 25. The mold. At 25 the molds. In the mold small conidia are there. In the mold small conidia. No particular shape. Small conidia are there. That's it. Okay, the other three tests are same. Drug of choice is again itraconazole, not amphotericin. Okay, so you can see. You see the yeast form of all. You see the mold form of all. See the yeast, see the mold. See Mickey Mouse, see pilot wheel. And see simple mycelial form with the hyphae with conidia. No particular shape. Coming on the last one. How many of you with me? Can I continue with the last one? Let's start the last one. The last one is candidiasis. I will teach you candida 4 times. Today I am teaching you first time. In the next 5 days, you will see 3 more times. Because candida comes in 4 systems out of 8. Okay, it comes in urinary also, genital also. It will come in pulmonary also. Okay, I will teach you multiple times. Chalo. So let's start candidiasis. Candida is the most common fungal infection in human. You know, the most common fungal infection in human is candida. It don't have any other name. Okay, most important causative organism is Candida albicans. But other candidas are also there, like Candida tropicalis, Candida gilbrata, Candida krusei, Parasipolis, Vishwanathi. There are many types of candida, but the main hero, these all are side heroes. These all are side hero. The main hero of the movie is Candida albicans. So please learn. Candidiasis is a disease caused by Candida albicans. Clinical feature, there are 4 types of presentation of the Candida. It can involve all the organs. From head to toe, it can involve any organ. That's why I will teach you this fungus multiple times. It goes in the blood and cause dissemination in any of the organ. It can cause meningitis, endophthalmitis, you know. It can involve esophagus. It can involve all the organs. So invasive candidiasis. Number 2, mucosal. It involves mucosal layer at 2 places. Number 1, mouth. Okay, in the mouth, it causes a curdy white. You can see curdy white coating. Curdy white coating on the tongue in the oral candidiasis. You can see oral candidiasis. If you try to remove this coating, with a tongue cleaner or something, just below that, the mucosa is erythromatous. It's red. It's vasodilated. It's erythromatous and it's painful. Okay, the same thing occurs in the vagina of the female. The vagina of the female also having this curdy white. You can appreciate the curdy white. The same curdy white coating. Again, we can remove it here and the underlying mucosa is having erythromatous appearance. So it can be oral candidiasis, vaginal candidiasis, mucosa involvement. Mucosa involvement can be oral, can be vaginal. So 2 type of candidiasis. Mucosal mein oral thrush, vaginal thrush. Oral candidiasis, vaginal candidiasis. Oral thrush, vaginal thrush. It can be cutaneous. Cutaneous mein it can be intetrigo, nails can be involved, paronychia, onychomycosis, and it can be allergic. So there are 4 presentation of the candida. Okay, lab diagnosis is important. It's not like all the systemic mycosis, histo, blasto, paracoccidio, coccidio. No, it's different. So direct microscopy and culture, but on culture it is not dimorphic. So I will not tell you 2 forms. Okay, I will tell you 1 form only. So direct microscopy, you will get pseudohyphae. I assume you know what is pseudohyphae. There are 4 types of fungus: yeast, molds. I told you what is yeast, what is mold. Pseudohyphae is between the 2. Pseudohyphae is actually yeast look like molds. Okay, and the 4th one is dimorphic. Okay, this is pseudohyphae. It is not yeast, it is not mold. It is something in between. You can appreciate the pseudo-hyphae. So actually it's the yeast which is keep on budding, keep on budding, keep on budding. It's a yeast which keep on budding, keep on budding, keep on budding. So it is looking elongated like a mold, but it is not mold. It is looking like a mold, and that's why it is not hyphae, it's pseudo-hyphae. So on direct microscopy, pseudo-hyphae is there. Culture on SDA, cream colony. Culture on SDA, cream color, white creamy colonies are there. Culture on SDA. Now the last thing is the test of speciation. Okay, how you separate the main hero, Candida albicans, from the side hero. How you, suppose I'm having a specimen, okay, and I do the direct microscopy. On direct, I do the culture. On culture, I get cream colony. So all Candida, main and side, main hero and side hero, they give cream colony. If I do the direct microscopy, I got pseudo-hyphae. But all Candida, main hero and side hero, they give the pseudo-hyphae. I want to differentiate the main hero from side hero. How can I do so? I can perform 3 tests. You get questions on that. This is known as test of speciation. This is known as test of speciation. Test of, in which we define the species, Candida albicans versus others. Okay, so germ tube test, also known as Renault Broad phenomenon, Dalmau plate experiment, and Chrome-agar. In germ tube test, we take the specimen. Now it is Candida, but I want to know which Candida. Is it albicans or others? So I will add few drops of blood or serum. Okay, rabbit blood or rabbit serum I will add. If it is, now Candida albicans love blood. If it is Candida albicans, germ tube arise not. If it is any other Candida, germ tube will not arise. It is known as germ tube test. You can appreciate the germ tubes. The germ tubes are arising out of Candida albicans, not others. It is positive in Candida albicans, not others. Second, Dalmau plate experiment. Okay, take SDA agar, okay, and inoculate this specimen. Inoculate, not simple SDA agar. In this SDA agar, add cornmeal. You know what is cornmeal? Corn क्या होता है? भुट्टा. हिंदी में तो भुट्टा कहते हैं. So cornmeal. So add cornmeal in the SDA. You love corn? I like corn. By the way, Candida albicans also like corn. Okay. So if you are inoculating, if it contains Candida albicans, it will convert into chlamydospores. If it is any other Candida, it will not convert into chlamydospores. So again, Dalmau plate experiment or cornmeal agar experiment, it is positive in Candida albicans, not others. So you can appreciate here, it is converted into chlamydospores. It is converted into chlamydospores. Last is Chrome-agar. Chrome-agar give different color to different Candida because of their specific enzymes. And last is beta-D-glucan acid. Okay, what is beta-D-glucan? It is a specific thing present in the cell wall of the Candida. Cell wall of the fungus. Cell wall of the fungus contains beta-D-glucan. So it is a test of invasiveness. Okay, so we are done with Candidiasis. See the drug of choice. Drug of choice for cutaneous Candidiasis is azole. Topical azole in the form of ointment, cream, azoles. And for systemic Candidiasis, it's also azole. It's also azole, but oral. Fluconazole, voriconazole. And if azoles are not working, you can give amphotericin B also. People, we are done with the 5 funguses. They are in front of you. Compare their yeast form, compare their mold form, see their lab diagnosis, say their other names. We are done. We are done with the 5 funguses. How many of you are with me? Still, we are done with 5 funguses. So what we have learned today, I would like to end the session now. Parasites, I will upload a recording for the subscribers on the app. Tomorrow I will upload the recording. Okay. What we have learned today, let me summarize. Okay, in this session, I'm having an important announcement. If you want to win the free subscription, wait, the quiz will be live after that. Wait. Okay, now, what we have learned today? Today, we have learned the bloodstream and CVS infection. Okay, total 21 organisms. I taught you 5 bacteria. I taught you 5 viruses. I taught you 5 funguses. So out of that, I told you 15. Remaining 6, the parasites, they are very easy, but it will take another 1 hour. Okay, the 6 parasite in a comparative manner we will take, but that I will upload as a recording. Okay, chalo. So the 5 bacteria we have studied in the form of the master chart. You can see 1, 2, 3, 4, 5. The master charts are ready with you. You can see the viruses, the 5 viruses. 1, 2, 3, 4, 5. The 5 viruses are ready with you. You can see the parasites. I didn't taught you today, but we will make this master chart tomorrow. 1, 2, 3, 4, 5, 6. And the last one, fungus. You can appreciate the 5 fungus. So this is what we have learned today. This is what. I was assuming that till now we will complete fungus also, but little bit we are late. But the same thing, all these master charts which I taught here, we are already given the 7 master charts in this master chart. Okay, the first, second page is the introduction. Here you can see the bacteria. Appreciate the bacteria I taught you today. These are the first 2 bacteria. These are the next 3 bacteria. Total 5 bacteria. Appreciate the red color. I'm teaching you the red color today. Okay, this is my color coded master chart. Make like this. Come on the viruses, total 5 viruses. Appreciate the 2 viruses over here and appreciate the next 3 over here. So total 5 viruses are done. Okay, appreciate the parasites, 3 plus 3. These are the 3 parasites and these are the next 3 parasites. Okay, hang it like a calendar. Daily flip the pages. That's it. You have to just flip the pages. Don't touch the book of microbiology. The complete microbiology will be on the wall and you can remember it like anything. Finally, fungus. The 5 funguses in front of you. We are done. We are done. Done. Of the complete CVS in just 7 pages. After that, new system. New system, blue color skin. Here also total 8 pages. Complete skin. After that, recipe. The complete 5 pages. Like that. Total 60 pages master chart. Okay, the complete replacement of the microbiology book. All 158 organisms. This is the way you have to study. Okay, now today we have done serious infection. A little portion is pending. And yesterday we have completed general microbiology. These 2 sessions were on YouTube. We will meet on Monday. Tomorrow there is no class. Sunday there is no class. We will meet on Monday, 14th. On Monday. 14th, 15th we have class, then 16th we don't have, 17th, 18th we have class, 19th we don't have, 20th we have last class. Appreciate the remaining system. I will teach you recipe, then I will teach you GIT, then SST, then CNS and hepatobiliary together, then urogenital and immunology together. So complete course of microbiology in just 7 class, 4 hours each, approximately 25 hours, 25 to 30 hours. That's it. So we are done. The remaining 5 sessions will be on the MedLife by Dr. Priyanka app. Okay. So hope to see you again on the app with the same version, with the next orange system, my orange system, the complete respiratory tract in which I will teach you more than 30 organisms in one shot. Okay, got it. Now the important announcement for today is we are going to make the quiz live. As soon as I will end the session, the quiz will be live. Okay, the quiz contains 10 questions. Each question, 30 seconds you are allowed. You have to read fast, you have to be fast and accurate. Okay, the quiz, the moment I will end the session, after 5 minutes, the quiz will be live. Okay, and the moment it will be live, after 20 minutes, automatically it will be disabled. Within 20 minutes, you have to give the test. And the top 20 scorers will be given FinalGear microbiology up to 100% scholarship. The top 3 given 100% scholarship, then the next 5 like that, 80% scholarship like that. We are having the complete distribution. The team will tell you the details. So try to give the test. Okay, the top 20 winners will get in today's test. They will be awarded up to 100% scholarship. Okay, and in this app, that is MedLife by Dr. Priyanka app, FinalGear microbiology, you will get total 7 live sessions, out of which 2 are done on the YouTube. 5 more live sessions will be there. Each session 4 hours. Recordings will be available depending on the plan the subscription is taken. Digital notes will be provided, not printable. Digital. Annotated notes I upload daily after the class. Okay, the annotations also you will get. Printable workbook already uploaded. Okay, so before my next class, I'm warning you to take the printout of my workbook. Your speed will be like anything. You can pace up with my speed. So try to solve all the MCQs and PYQs in the question bank. The complete question bank is already uploaded for you. And daily quizzes are there. After the test, I upload a 50 to 100 question test. That is a separate from the quiz. Okay. If you have any doubt, kindly note down our number. It's 9321001103. And I'm available on all social media platforms by MedLife by Dr. Priyanka. I'm available on YouTube, Instagram, as well as on Telegram. So you can ask your queries there. Whenever I will be free, I will leave a voice note on that. Thank you so much. Hope to see you again. Soon, I am going to launch the same FinalGear pathology and FinalGear pharmacology on huge demand of the students. Okay, so same, we will cover the entire pathology in 7 sessions, 25 hours. Entire pharmacology, 7 sessions, 25 hours. And cherry on the top. So this master charts will be available for pathology as well as pharmacology. Okay, these master charts are available on our website for the purchase. For sale, they will open from 14th of the July. After 3 days, they will be open. And if you want, the main thing is that I prefer you should make of your own. But if you are lack of time, you can go for the ready-made version. But make of your own. It is the best thing. Okay. The same is available for the pathology, in which we will cover 150 diseases in comparative. All cancers on one page, all brain tumors on one page with their histo images. Okay. Similarly for pharmacology, all 150 drugs in comparative system-wise color coded. Okay. So the same master chart is available for patho also, for pharma also, for micro also. So we will replace the 3 books with the 3 calendars. Your room, 3 calendars. Keep on flipping the calendars. You will not realize when entire second prof 3 subjects will be at the tip of your tongue with 100% accuracy without missing any concept. That's my guarantee. And try any MCQ of any of the competitive exam of any of the platform. I challenge. If you are there, kindly accept my challenge and solve any MCQ with the help of these master chart. Okay, thank you so much. Hope to see you again. Bye-bye. It was a very nice session and thank you for giving your precious time to me. Okay, I would like to end the session. Bye-bye.